O sea, si dejamos de comer lo que comíamos, vamos a perder la identidad con nuestro entorno. O sea, es el reservorio de sabiduría de los pueblos que todavía recordamos a qué saben las cosas y cómo se preparan las cosas y sobre todo cómo nos alimentaron durante tantísimos años.
If you want to have a healthy life and you want to have a stable planet, what can you do best from the perspective of what we eat? My name is Johan Rockström. I'm a professor in Earth System Science at the University of Potsdam and the director of the Potsdam Institute for Climate Impact Research in Germany. The world needs a global scientific assessment of what does science say with regards to healthy diets, what gives the best outcomes for healthy lives in terms of what we eat, but also how can we eat within the safe planetary boundaries. And there you have at heart the core of the Eat Lancet Commission work.
The planetary health diet is really a reference diet, a guidance. It recommends food groups rather than specific food items so that it can really adapt to the food culture of different countries and regions in the world. It is really based on non-processed or minimally processed food. You can adapt that general guidance on different food groups to the local situation.
In its simplest form, the planetary health diet tells you make the vegetables the star of the dish. Consume animal source foods in moderation, consume other plant proteins, and increase your consumption of fruits and nuts at the same time.
It's highly variable. We can substitute different foods. It's compatible with Western diets, with Asian diets, with African diets. So there's a lot of space in there for people to eat what feels good to them.
I might love beans, you might love chickpeas. It's great, both are legumes. There's something for everybody in the planetary health diet.
One should really recognize that the planetary health diet gives us the boundary conditions of what science says universally for all people in the world gives the best outcomes for our life expectancy.
This is a diet that is really good for our bodies, is going to help us live longer, feel better, have happier, healthy families. And it'll also have some profound side effects. Most important for me as a climate scientist is the impact it can have on climate. So by adopting this diet all around the world, what we'll do is have far less pressure on our land. We can produce what we need in a much smaller land area, leaving much greater space for nature, for biodiversity to thrive, for water systems to be clean, and for our climate to be stabilized.
La chinampa representa un universo. Limpian el aire, se ofrece agua, capturan carbono y es un jardín lleno de todo lo que se produce, ¿no? Entonces, yo creo que son de enorme y de vital importancia para la Ciudad de México. Yo soy Nora Lorena Estrada González y soy cocinera tradicional. Estamos en mi casa, estamos en Xochimilco, estamos en la Ciudad de México. La dieta ha ido cambiando muchísimo. Sin embargo, mantenemos todavía y te comes el tiempo, te comes el verano, te comes el otoño, te comes todo lo que hay. Creo que con eso lo resolvemos muy bien y no dejamos una huella ecológica gigantesca, ¿no? Cuando cocino con todos los ingredientes de la chinampa, siento que estoy resistiendo, que de alguna forma no estoy provocando la desaparición de la chinampa. Bueno, hoy estoy preparando algo que a mí me gusta muchísimo, que se llama tlapique de pescado, porque de entrada se cocina en hojas de maíz. Esa va a ser, pues, nuestra vasija. Se le ponen, por ejemplo, cebolla, se le pone pasote, que es lo que lo va a aromatizar, unos pocos nopalitos y tiene el pescado. Entonces eso se va a envolver y se va a cocer directamente en el comal. Entonces estamos haciendo una sopa, un caldito de huitlacoche que tiene jitomate. También vamos a preparar, vamos a hacer una ensalada de quelites que vamos a coronar con una tortita de amaranto. La salsa es una técnica también que ocupa el tatemado, que se va al comal, que los jitomates se van a caramelizar junto con los chiles, entonces le va a dar un sabor totalmente, dulzón, digamos, por una parte, aunque va a sacar lo picante del chile. O sea, el mexicano, la mexicana, comemos chile. Eso no tiene la menor, eso no tiene vuelta atrás. No tienes aditivos, o sea, es totalmente sano y sobre todo sabroso.
Switching from the current diets in the world, the number of deaths that we could prevent over 10 million people every year, and it goes up to about 15 in some of the estimates.
When I think of the shift to predominantly plant-based diets, in an African context, their diets are very much plant-based. What dominates is starchy staples. So we do need, for many of the population on the African continent, to shift towards more nutrient-dense diets and shift towards a planetary healthy diet eating pattern, if you will.
The Maasai traditional diet, first of all, our animals give us the food we need. So milk is the main one. And from milk, we get traditional yogurt, we get ghee in form of a fat. That was my main meal growing up. My name is Selina.
Ladies and gentlemen, may I have your kind attention, please? Our program will begin shortly. Before we start, kindly allow us to share a few important guidelines for today's webinar. First, we kindly request all participants to keep their microphones muted throughout the presentations to ensure a smooth and uninterrupted session. Second, during the question and answer session, you are welcome to submit your questions via the provided Google form link. Please include your name and institution. The moderator will then convey your question to the respective speakers. Lastly, please note that the use of annotations or any drawing tools during the presentation is not permitted, as it may be visible for all participants. Thank you for your kind attention and cooperation. Good morning. Distinguished speakers, honorable guests, respected moderators, and all participants. It is a great honor for us to welcome our esteemed speakers who have kindly joined us today. Professor Dr. Insinyur Daniel Mudiarso, MS, Professor Dante S. Harbuwono, MD, SPPD, KEMD, PhD, Mr. Pungkas Bajuri Ali, STP, MS, PhD, Dr. Neha Kanpur, SCD, MSc, FAHA, Professor Juan Rivera Domarco, PhD, Professor Rina Agustina, MD, PhD, as well as our distinguished panelists, Ms. Is Ratnasari, SKM, MSc, Mrs. Siti Nadia Tarmisi, MD, MEPIT, Mrs. Dina Kania, SH, LLM, Mr. David Coloza, PhD, Mr. Ibnu Budiman, MSc, Mrs. Supra Wimbarti, MSc, PhD, Psycholog, and our respected moderator, Professor Yodi Mahendra Datta, MD, PhD. Ladies and gentlemen, my name is Ilana, and I am truly honored to serve as the Master of Ceremony for today's event. On behalf of the organizing committee, it is my great pleasure to warmly welcome all of you to this international webinar entitled Eat Real Food and Minimally Processed Diets for Child and Youth Health. This webinar is hosted by the Commission of Medical Sciences under the Indonesian Academy of Sciences in collaboration with the EAT Foundation, the Master of Nutrition Study Program, Faculty of Medicine, Universitas Indonesia, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, the Global Alliance for Improved Nutrition, and the Food and Land Use Coalition. This brings together experts from diverse institutions and disciplines to share scientific evidence and discuss policy strategies related to ultra-processed foods, dietary guidelines, and food environments for children and youth. We are delighted to have all participants joining us today, both locally and internationally, and we sincerely hope this session will be insightful and enriching for everyone. Ladies and gentlemen, to commence our program, may I kindly invite all participants to rise and respectfully sing the national anthem of Indonesia, Indonesia Raya. Ladies and gentlemen, we now come to the welcome and opening remarks session. It is our great honor to invite our distinguished speakers to deliver their remarks. Allow me to briefly introduce our speakers. Our first speaker is Professor Dr. Insinyur Daniel Mudiarso, MS. He is the president of the Indonesian Academy of Sciences for the 2023 to 2028 term, professor at IPB University, and Principal Scientist at Central for International Forestry Research. He has extensive experience in climate change research and has received numerous international recognitions. Ladies and gentlemen, please welcome Professor Daniel Mudiarso. Professor Daniel, the screen is yours.
Thank you, announcer. I'm sorry, I cannot switch my camera on. I don't know why. Maybe you can tweak from your end. I'm trying very hard since I get in there, but no success. But without my picture or my face, I'm really welcome this session, webinar, which has been thought for a while by our colleagues in the Commission of Medical Sciences. Let me bring you a bit closer to our academy, which has 5 commissions, including Medical Science Commission, There are 4 others: engineering, basic science, culture, social sciences, and engineering. So with these 5 commissions, we are trying to be part of the community by conveying scientific excellence to the community, including government, parliamentarian, and also civil society. We work very closely with universities and research organizations nationally and globally, including this event. We embrace colleagues from University of Indonesia, Gajah Mada University, and other organizations in Indonesia. So let me give you a word of warm welcome to our community, and also some word of thanks, especially to colleagues who are, I think, switching their camera now from different time zone. And I believe it is not easy to start at your time, especially those from Mexico. I think it's about, 6 o'clock? No, 10 o'clock in the evening. Right. So thank you for joining this event. And I think we should also recognize the support of the Ministry of Health and welcome Professor Dante Saxono to be with us today. And also from Bappenas, this is our national planning agency. The Vice Minister is here, Dr. Pungkas Bajuri Ali. Thank you, sir, for being with us today. I believe the outcome from this conversation today will be directly
Izin Prof, saat ini masih termute. Apologies, everyone. It seems that we are having some technical issues. We will be shortly waiting for Professor Daniel to return.
Ilana, can you hear me?
Yes, Prof, we can hear you now.
Sorry, there's a lot of bugs here. Also would like to thank all panelists. We have a whole set of distinguished panelists today, and I'm sure we will be hearing refined and new science and findings in order to be able to suggest how can we come out with good policy in terms of feeding our community, in terms of advising the diets, especially for young people. Indonesia is in the middle of struggle to help how the school food is going to be presented and served. And I think the outcome from this webinar will be directly used by them. And I encourage our official here to be able to convey the message from this event, because from the scientific perspective, we only need to have kind of help and also collaboration with policymakers. Otherwise, the result from scientific research findings will only be stacking in our bookshelf. So please help us, and I would like to again emphasize the importance of this collaboration. Thanks to the chairperson of the Medical Science Commission, Professor Hera Watisudoyo has been working very hard to prepare this event, and I believe there will be trickle-down effect from today's event, although it's only half day. A number of stakeholders is waiting for the result of your hard work here, Ibu Hera. So with that, I would like to thank your support and hard work, especially when you're gathering a lot of these distinguished people in our session today. A direct effect of this undertaking, I guess, is to support Indonesia's effort to protect children and also adolescents' diet, especially those which are quite risky, which is very much and widely consumed by the community today. So again, how strategic it is, the outcome or result of this event. And this is also very relevant to our government plan and policy regarding how to strengthen national dietary in Indonesia. So the guideline is already there, but we need to revisit whether or not this the outcome from this work is really useful for them. I was trying to search what EAT is all about. EAT Foundation, I am very admired with their work across the world. I don't know what it stands for, but certainly it means something related to our diet, our food, and also the security as well as the safety of this diet for our community. I believe the work of EAT and EAT Lancet framework will be very useful for Indonesia, and we are, as academy here, eager to be the conduit or bridge for you to be able to outreach our community, especially in Indonesia. So let's dig up the science we have and present that to the policy community, and then we can discuss today how can the policy be shaped towards safe food for our next generation. IPI is very eager to be the conduit, to be the bridge of this work, to be able to influence the policy processes, and more importantly, the action that this kind of work is really having the impacts to the community. It may not be a full success. We are also eager to evaluate if they need to be evaluated. So I think this collaboration among scientists and institutions is very much welcome, especially the Academy of Science in Indonesia is very keen to continue working with you all, both internationally and nationally. So with that, I would like to officiate this event and open it officially. Thank you very much.
Thank you, Professor Daniel, for your insightful remarks. Ladies and gentlemen, we will now continue to our opening remark, which will be delivered by Professor Dante Saxono Harbuwono, Vice Minister of Health of the Republic of Indonesia, professor at Universitas Indonesia, and a leading expert in endocrinology and metabolic disease. He has held key roles in national and international health organizations, including serving on the Global Fund Board. Ladies and gentlemen, please welcome Professor Dante Harbuwono. Prof. Dante, the screen is yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning, greeting out of all. Swastiastu, Namo Buddhaya, salam kebajikan. Distinguished guests, Professor Daniel Mudiarso, the President of IIP, Dr. Pungkas Bajuri Ali, Deputy Minister of Bapenas, speaker, expert, college, and all participants. Allow me to begin with a simple question. When a child in Indonesia reaches for food or drink today, whether in school canteen in Jakarta or Jayapura, or through a food delivery apps, what do you think is available to them? What is affordable? What is feasible? In many cases, the answer is not water. It also not healthy drink. It is brightly colored, heavily sweetened product, inexpensive, convenient, and designed to be chosen repeatedly. I raise this question to remind us how something important. What we consume is not only a matter of individual choice. It's shaped by the environment around us. And if we want a different choice, we must shape that environment. This thing escalates. Today we are facing what experts call the triple burden of malnutrition. First, stunting, a condition caused by chronic undernutrition in early life. Its consequences follow a child for decades. It affects how they learn, grow, and contribute to society. Second, we are seeing a rapid rise in overweight and obesity. Nearly 1 in 4 Indonesian adults is living with obesity. Among adolescents aged 13 to 17, near 1 in 5 is overweight. These adolescents at a high risk of development diabetes, hypertension, and heart disease in later life. The cause of this condition cannot be ignored. We spend 38 trillion rupiah each year to heart disease, kidney failures, and stroke. If we do not act now, we will keep paying a far higher price. We will also lose the productivity due to those diseases. The government of Indonesia has made a clear shift from focusing only on treatment to strengthening prevention. We have significant progress of stunting. In 2024, the prevalence declined to below 20%, a meaningful reduction and one we should acknowledge. To prevent obesity, we recently introduced the Nutri-Level system, a simple color code label so that anyone, regardless of education or background, can immediately understand the nutritional content of what they are about to eat or drink. The principle is simple. Good health begins with good food choices, and good food choices begin with good information. The nutrition level has gone viral in a positive way, and we hope this momentum will support healthier dietary behavior. But from this point, we must go further. First, we must continue all to enable healthier food environments, especially for children. Second, we must regular from food marketing because it prevents choice and eventually consumption. It is not the responsibility of a single ministry. Reflecting of my question in the beginning, let us work together so that in the future, what is available, affordable, and feasible to all of us in also what is healthy. I wish you all a good webinar. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Prof. Dante, for your valuable and insightful remarks. Ladies and gentlemen, we continue to our final speaker for this session, Mr. Pungkas Bajuri Ali, STP MS PhD, Deputy Minister at the National Development Planning Agency. He serves as a Deputy for Human Development and Culture at the Ministry of National Development Planning, Republic of Indonesia. He has held several strategic positions, including Senior Advisor to the Minister of Social Affairs and Poverty Alliance and Director of Public Health and Nutrition. Ladies and gentlemen, please welcome Mr. Pungkas Bajuri Ali. Sir, the screen is yours.
Thank you, Ilana. Distinguished guests, President of the Indonesia Academy of Sciences, Prof. Daniel Mudiarso, the Vice Minister of Health of the Republic of Indonesia, Prof. Dante Saksono Harbuwono, distinguished keynote speakers, panelists, colleagues, Assalamualaikum warahmatullahi wabarakatuh. Good morning and a very warm welcome to everyone. Let me begin my presentation by expressing our appreciations to organizers for convening this webinar and invite us to participate. Today's discussions sits at the intersections of science, policy, and everyday life, because what children eat is not just a matter of nutrition, but of health, equity, economic systems, culture, and the future of our societies. Over the past decades, the concept of ultra-processed food has gained increasing attention. A growing body of scientific evidence suggests strong associations between high consumptions of ultra-processed foods and adverse health outcomes, ranging from obesity and metabolic disorders to poorer dietary quality among children. Many countries have begun to reflect this evidence in their dietary guidelines, emphasizing whole, fresh, and minimally processed food. The topic we are discussing today is highly relevant, but it's also important to recognize that this topic is not without controversy. From the public policy perspective, discussions can be more complex, ranging from the classification itself, its association with health, and its interactions with food system transformations, socioeconomic behavior, and very often also cultures. While the evidence linking to UPF to health risk is expanding, there are still important scientific questions. Not all UPF are equal. Some are energy dense and nutrient poor, while others are fortified and may play a role in addressing micronutrient deficiencies, especially in low resource settings. We must acknowledge the complexity of food system. For many families, particularly in urban areas and low-income settings, the choice of food is determined by accessibility and affordability. There is a gap between global recommendations and local realities. Much of the evidence we rely on comes from the high-income countries, yet dietary patterns, food environments, cultural practices, and economic constraints differ significantly across regions. What works in one context may not be directly transferable to another. So we need to invest in research that reflects local consumption patterns, local food systems, and local health burdens. This includes understanding not only dietary intake, but also socioeconomic behavior drivers that shape food choices, particularly among children and adolescents. Such evidence is critical to inform policy design that is targeted, effective, and equitable. At the same time, policy responses should not be fragmented. We need a more integrated approach to food system governance. This includes strengthening dietary guidelines that are practical and culturally relevant, enhancing regulatory frameworks on food compositions, labeling, marketing, particularly to protect children, utilizing fiscal instruments to incentivize healthier food choices, and investing in local food productions and distribution system to improve the availability and affordability of nutritious food. In Indonesia, these priorities are aligned with our national development agenda. Within our long-term development plan and our medium-term development plan, food and nutrition are positioned as the central pillars for human capital developments. Our targets, improving life expectancy and reducing stunting, underscore the importance of ensuring adequate, safe, and balanced nutrition across the life course. Achieving these targets requires coherence, cross-sectoral policies, linking health, agriculture, industry, education, and social protections. Distinguished participants, moving forward, the key challenge is not only generating evidence, but also ensuring that the evidence is translated into actionable and context-sensitive policies. Therefore, we hope that this webinar will contribute to deepening our collective understanding of the issue, identifying critical evidence gaps, particularly in local contexts, and formulating policy recommendations that are both scientifically sound and operationally feasible. In closing, let us use this forum to strengthen collaborations across sectors and disciplines and to advance a shared commitment, ensuring that all children have access to nutritious, safe, and affordable foods now and in the future. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Mr. Pungkas, for your thoughtful remarks. Ladies and gentlemen, we sincerely appreciate the insightful perspectives shared by our distinguished speakers. These remarks have set a meaningful tone for today's session. We will now move on to the next session entitled Child Health, Food Systems, and Policy Context. This session will be moderated by Professor Yodi Mahendra Datta, MD, PhD, Dean of the Faculty of Medicine, Nursing, and Public Health, Universitas Gadjah Mada. Prof. Yodi is the Dean and Professor of Health Policy and Management at the Faculty of Medicine, Public Health, and Nursing, Universitas Gadjah Mada, Indonesia. He is a prominent expert in global health and health systems, actively contributing to the Lancet Commissions and leading regional networks in health research and disaster health management. His research focuses on health policy, implementation science, and global health. Ladies and gentlemen, please welcome Prof. Yodi Mahendra Datta. Prof. Yodi, the screen is yours.
Thank you, Mbak Ilana. Assalamualaikum warahmatullahi wabarakatuh. Distinguished speakers, honored guests, and participants. Around this time, across Indonesia, children are at schools. They're now sitting in their classroom. Now, inside their backpacks, most likely would not just be books and stationaries. Most likely we will find brightly packaged snacks and sugary drinks. They are quick, they're affordable, and they are everywhere. So what the school bag is holding is actually more than just food and drink. It's a signal of how our food system are shaping choices, even before children can actually choose. Because today, for millions of children, the foods that are most available, most affordable, and most heavily promoted are not the food that nourish them, but the foods that may harm them over time. And this is not a distant problem. It's happening in our cities, our schools, our communities every single day. So the question is no longer whether this matters or not. The question is, what are we prepared to do about it? My name is Yodi Mahendra Datta, and I'm honored to serve as the moderator for these sessions on child health, food systems, and policy context. Now, this keynote session will bring together three powerful perspectives: the evidence that shows the impact, the system that explains the drivers, and the policies that can change the trajectory. And our mission is not just to speak about them, but to connect them and to move from awareness to action. Because at the end of the day, This is not just about food, it's about the kind of future we are creating for our children. So with that, it's my great pleasure to invite our first keynote speaker. It's my great pleasure to introduce Dr. Neha Kanpur. She is the assistant professor at the Division of Human Nutrition and Health, Wageningen University in the Netherlands. Dr. Neha's research focuses on the relationship between dietary patterns and non-communicable diseases, as well as developing interventions to promote healthier food choices across diverse global contexts. She's actively involved in international initiatives, including Informas and the American Heart Association, and has collaborated with organizations such as UNICEF and the Pan-American Health Organization. She will present on ultra-processed foods and child health evidence. Dr. Neha, welcome, and thank you for joining us so early in the morning there. The screen is yours.
Thank you very much, everybody. I just want to make sure that you can hear me okay and see me okay.
We can hear you, and we're hoping to see you. Okay, we can see you now.
Wonderful. Good morning, everybody. Thank you so much to all of the distinguished speakers, the panelists, and the guests today, and all of the participants. It is my absolute pleasure to be part of this important and significant event for Indonesia, and an absolute honor to be able to support and contribute to it. My name is Neha Kanpur. I am at the Institute in Wageningen, the Wageningen University in the Netherlands. And today I have been invited to share the evidence on ultra-processed foods and child health. Before I start, can I just confirm that you could see the screen?
Yes, we can see.
Wonderful. Well, thank you again for this important honor. My keynote focuses on the evidence on ultra-processed foods and child health, and it reflects the collaborative research and work of over 40 of my colleagues. I'm here representing all of their work. I would like to begin by leaving us with 5 key messages. I will go on with my presentation to build on these messages. The first message is the NOVA categorization system, which is the framework within which ultra-processed foods and minimally processed foods are identified, presents the ideal framework to segregate real foods and minimally processed diets from ultra-processed foods and ultra-processed diets. Ultra-processed diets provide about 38% of calories to the diets of children globally, with some variability. The sales of ultra-processed foods are increasing, and this is of concern. Ultra-processed food dominant diets are linked to several adverse health outcomes in adults, and there is evidence emerging for such impacts on child health as well. And the collective evidence warrants policy levers that promote minimally processed diet and target the food environment drivers of ultra-processed foods. So I will begin with the first key message. So the NOVA categorization system is really a framework that is based on the extent and purpose of industrial processed foods and industrial processing. It accounts for all the physical, biological, chemical methods that are used during the manufacture of foods, including the use of additives. So on your screen, you see examples of the processing methods. They range from anywhere to the removal of the mechanical removal of unwanted parts of foods, drying, grinding, all the way down to molding, pre-frying, hydrogenation, fractionation, grinding, and chemical modifications. The use of additives ranges from, fortification, preservation, to additives that are included for cosmetic purposes. And the purpose of processing, really, which is the third element that NOVA straddles, includes elements of maximizing food safety through pathogen destruction, improving durability and preservation, palatability, to improving ready-to-heat, eat convenience, and organoleptic mimicry, which essentially is the flavors and the tastes of food. Yes. And so this is another slide that essentially breaks down the NOVA framework into the 4 groups that comprise it. There's the group 1, which comprises of unprocessed or minimally processed foods. Group 2 is the processed culinary ingredients. Group 3 is processed foods. And group 4 is ultra-processed foods. There is variation in the nature and type of processing methods that each of these 4 groups undergo. So group 1 has more of the mechanical processing methods and techniques, all the way to group 4, which includes those techniques along with more intensive industrial techniques of extrusion, molding, pre-frying, fractionation, and chemical modification. The additives also vary from one group of NOVA to the other. So in group 1, the additives include fortifying compounds. Similarly, in group 2 and group 3. Group 3, in addition, includes preservatives, and group 4 includes all of those alongside the cosmetic additives and ingredients of rare culinary use, as is defined within NOVA. I just want to draw your attention very briefly to the fact that for a food to be fortified, it does not have to be ultra-processed. It could be a group 1 food, a group 2 food, or a group 3 food. Again, the extent of processing varies between each of the 4 NOVA food groups, in which group 1 largely preserves the original food matrix, to group 4, where the preservation varies by the product. And to make this a little bit more salient to you, I have a few slides with examples of products that comprise each of the 4 NOVA groups. So raw vegetables and fruits and whole grains and nuts and milk and dairy and animal products would be in group 1. Group 2 really is the culinary processed ingredients, so includes elements that you would cook group 1 with. So butter, salt, sugar, and oil. Processed foods essentially is the addition of group 1 with group 2 foods to give you tinned and canned fruits and meats, and also breads and cheeses. Group 4 are really the formulations of these products. So they include foods that you could commonly think of as fast foods or ready to eat, ready to heat equivalents. The entire idea that NOVA captures is that traditional whole food-based dietary patterns are made up of group 1, 2, and 3. So they're made up of unprocessed or minimally processed foods, made up of processed culinary ingredients or processed foods. So irrespective of where we are in the world, the traditional whole food-based dietary patterns are really comprised of groups 1, 2, 3. Group 4 are equivalents of meals and snacks that were traditionally produced using a combination of group 1, 2, and 3. So putting it another way, visually, it is the sugar-sweetened beverage that are replacing the waters. It is the ready-to-eat sweetened yogurts that are replacing plain yogurts that originally had potentially either plain or with fruit. It is the sugary, ultra-processed cereals that are, substituting whole oats, ultra-processed breads that are substituting whole grain bread that were produced within artisanal settings, and ready-to-eat meals and snacks that are substituting freshly prepared meals and snacks. And it is in this substitution that the health effects essentially we find lie. So the second key message was to show you about the extent to which ultra-processed foods have penetrated already the diets of children, particularly globally. Just as a reminder, when we talk about ultra-processed diets essentially are conceptually based on the amount of ultra-processed foods that contribute to the daily caloric intake of the individual. So for instance, you could have a low exposure to ultra-processed foods if you have only a few ultra-processed products contributing to total dietary intake. A medium exposure would, of course, mean a larger portion of your calories are coming from these products, and a high exposure or a ultra-processed diet is one in which ultra-processed products comprise a larger portion of your total dietary intake. And we find that depending on which region or which country you're looking at, that it is not an insignificant portion of children's diets that are coming, and calories to children's diets that are coming from ultra-processed foods. So the graph in front of you has 16 different countries. Indonesia is here in the box in red. The different bars represent children of different age groups. The lighter bars are children between 0 to 5 months of age, and the darker blue bars represent children 2 to 5 years of age, 6 to 12, and 13 to 19. And you can see if you were in Colombia and you were a child between 2 to 5, on average, ultra-processed foods would comprise about 20% of your calories. In children in the US and the UK, almost irrespective of whether they're 6 or 13 or 2, over 60% of their calories are coming from ultra-processed foods. In Indonesia, that number, at least for 6 to 12 and 13 to 19 years old, is slightly lower at about 20%, but quite high at almost 40%. And just as a reminder, these are data from nationally representative surveys in all of these countries. So the mean contribution of ultra-processed foods to total caloric intake among children's and adolescents' diets is fairly significant. Sales of ultra-processed foods are increasing globally. We know this from the recent work that we did on the Lancet series on ultra-processed foods and human health, where we see that depending on the different region of the world, if you looked at the annual volume of retail sales in kgs per capita across different types of ultra-processed foods, you could see that there was a trend in the low income, and upper middle income countries towards a slight increase in sales, going from 2007 all the way to 2022. In high income countries, there was a plateauing of these sales. In low income countries, the sales were largely driven by sweetened carbonated drinks and sweetened non-carbonated beverages. Baked goods were, I think, also a substantial contributor. Whereas in higher income countries, there were, alongside sweetened beverages, which was slowly declining, very, very marginally, it was dairy products, sauces, reconstituted meat products, and other ultra-processed food products that really drove the sales that we see. This is another representation of the volume of sales of non-essential foods, many of which could be categorized as ultra-processed, between 2004 and 2022 by region and country. So you see the grams per capita per day consumption on the x-axis, and I've just highlighted for you how Indonesia fares compared to several other countries. So not as high potentially in sales, at least so far, between 2004 and 2022. In Indonesia compared to, say, Argentina or Mexico. But we suspect, given what we've just seen from the Euromonitor sales trends, that there is likelihood of increase. Ultra-processed food dominant diets are linked to several adverse health outcomes in adults, with emerging evidence to suggest similar effects in children. So what you see in front of you is the product of, again, the Lancet series on ultra-processed food consumption and human health. This was a meta-analysis of over 100 studies from global regions, cohort studies. So these were participants that were followed ahead of time. Adult participants, I have to just highlight that. And we found that across different types of health outcomes, whether that was abdominal obesity or Crohn's disease or type 2 diabetes or overweight or obesity, coronary heart disease or mortality, cardiovascular disease mortality, colorectal cancer or all cancer mortality, there was a consistent increase in the risk for these diseases when you compared diets high in ultra-processed foods with diets lower in ultra-processed foods. And that increase in risk varied by type of disease, of course. But just to highlight one, for instance, for obesity, overweight or obesity, your risk of overweight or obesity was 21% higher on average if you had a high ultra-processed diet compared to a low ultra-processed diet. And these are results from adults. We don't have as much of an evidence base for children. I think this is still growing, and the importance of this cannot be stressed enough. We need to collect better and more data on the impact of ultra-processed food on the health of children. But what we do know from our work on the UNICEF report on child health is that ultra-processed dominant diets are linked to inadequate nutrient intakes. They compromise diet quality. So they're correlated with lower potassium, fiber, protein, zinc, magnesium, and vitamins, and higher energy density, free sugar, and total and saturated fats. They're linked to micronutrient deficiencies, including anemia, although that is less well established. And really, this a link needs to be better studied. There's also some suggestion that higher UPF consumption at 2 years of age is associated with lower length for age Z-scores at 4 years. So stunting was one of the few outcomes that we were able to capture within children. There are also some emerging evidence to suggest adverse neurodevelopmental outcomes, whether it was measured by being cognitive performance, emotional well-being, ability to regulate emotions, and mental health amongst children. But there is compelling evidence for increasing overweight and obesity of an ultra-processed diet. So greater adiposity that was measured in through fat mass, waist circumference, BMIs, was higher on a high ultra-processed food diet amongst children and adolescents. When we combined all of the evidence on prospective studies where children were followed up in time, 11 of the 13 studies that we compiled reported a significant positive association between increased ultra-processed food consumption and increased adiposity over time, measured using different indicators. So this is just a snapshot of what those studies were, where we captured in children changes in BMI, skin fold measures, weight circumferences, fat mass and fat-free mass percentages across different prospective studies globally. And just as a reminder, the impact of an ultra-processed food diet on all of the health outcomes that I had previously mentioned is under active research. We have already been able to generate evidence to suggest that it's really the lower nutrient quantity of these ultra-processed diets that are driving some of the health impacts we see. Emerging evidence will need to be generated on changes in food matrix and texture, potentially if there's any impact from contaminants that are generated while these products are being formulated, whether food additives and other cosmetic ingredients are contributing to these health impacts, and whether their contact materials, so the packaging itself, is contributing to some of the health harms that we see. And these health harms are unlikely to be single causal agents. It is the combination of the lower nutrient quality, of the changes in the food matrix, and all of these other dimensions that increase the eating rate and promote overconsumption, impact the availability of nutrients, increase the eating rate, and increase dietary exposure to all of the cosmetic additives that we just mentioned. Changes potentially that are reflected in changes in lipid concentrations, modified gut microbiota, inflammation, oxidative stress, potentially insulin resistance and hypertension. All of these are hypothesized underlying biological mechanisms that are underpinning the health impacts that we see. And my last message for today is that all of this evidence that predominantly we see from adults, but emerging suggestions amongst children as well, suggests that policy levers that promote minimally processed diets and target the food environments would be best positioned to target ultra-processed food consumption and bring it down. So just to leave you with some considerations for policy, The preventive action on ultra-processed foods could be based on the UN Convention for the Rights of the Child and the precautionary principle approach, where we don't wait till we have the perfect evidence base to do something. We act based on the evidence that we do have, despite how imperfect it currently is. It is very compelling in terms of direction and magnitude to warrant action. We've heard from several of our speakers today, we need synergistic and complementary policies that are very attuned to the realities of the contexts, that can promote minimally processed foods and target several of the drivers of ultra-processed foods intake, and whether these take the form of national food-based dietary guidelines, restrictions to marketing and advertising, price changes of UPF relative to non-ultra-processed foods, target access and availability, and also consumer of information and general power asymmetry that exists through labeling awareness. Those could be potential considerations for the context. So just to summarize again, I leave you with the 5 key messages about the importance of NOVA in underpinning and segregating real food from ultra-processed foods, highlight how ultra-processed foods are really contributing a significant portion of calories to the diets of children as sales are increasing. This is of concern because we have seen, especially from adults, that ultra-processed food dominant diets link to ill health, essentially, and it's sufficient evidence to warrant policy action. I will stop there. I thank you very, very much for this invitation again, and for your time and attention. Thank you.
Thank you very much, Dr. Neha, for that really insightful presentations. I think the message is really clear. Rising consumption of ultra-processed foods in children's diets are linked to several adverse health outcomes, and thus calls for policy action to shift food environments toward minimally processed, healthier diet. So we now move to our second keynote speaker. It is my honor to introduce Professor Juan Rivera Domarco, Emeritus Professor and Investigator at the National Institute of Public Health in Mexico. Professor Juan is a leading global expert in nutrition and public health, with extensive contributions to research on malnutrition and policy development. He is a member of the Eat Lancet Commission and has authored more than 700 scientific publications, with numerous international recognitions, including Mexico's National Prize of Sciences. He will present on Healthy Diets from Sustainable and Just Food Systems, the 2025 Eat Lancet report. Professor Juan, bienvenido. Muchas gracias for joining. The screen is yours.
It is an honor for me to participate in this webinar and to share scientific evidence that justifies the need for the transformation of our food systems into healthy, sustainable, and just. I work at the National Public Health Institute in Mexico, and I am also an Eat Lancet commissioner. This is the outline of the presentation. I will start by an introduction, then talk about children's right to nutritious food and healthy environments, then move into the Eat Lancet framework on health, sustainability, and equity, then talk about the challenges of feeding 9.6 billion people healthy diets from sustainable and just food systems in 2050, talk about the recommended policy actions for transforming the food systems into healthy, sustainable, and just, and some practical country experiences applying these policies, particularly in the case of Mexico. We learned from keynote 1 from Dr. Neha Kanpur, clearly presented evidence that traditional healthy dietary patterns have been displaced by ultra-processed foods, leading to lower dietary quality. Evidence also of the association between ultra-processed dietary patterns and increased risks of overweight, obesity, several non-communicable diseases, mortality, and also evidence about high exposure of children and adolescents to unhealthy food environments which offer and promote the intake of ultra-processed foods. Here I present the number of children and adolescents who live with overweight or obesity globally. They almost doubled from 227 million in 2000 to 446 million in the period 2022-24. Globally, 32% of adolescents consume regularly soft drinks, 60% consume more than one sugary food or beverage, and 25% consume more than one salty processed foods. And these numbers are much higher in some regions. 75% of young people, 13 to 24, reported watching advertisements for sugar, energy drinks, fast food, or snacks during the previous week. So in summary, unhealthy food environments promote ultra-processed foods, which harm children's health. So protecting the children's right to nutritious food and healthy environments should be a very high priority. The Convention of the Rights of the Child recognizes that all children are entitled to the right to healthy food and adequate nutrition. The Article 24 of the Convention affirms the right of every child to the highest standards of health, access to clean water, nutritious food, and a secure environment. And by secure environment, we mean to live in a non-toxic environment and in a safe climate in the present and in the future. Given that children are in the process of developing their agency and autonomy, states, countries, society have the obligation to protect the rights to healthy food and to healthy environments. If we don't protect the rights to a healthy food of our children, who will do so? So I move now to the 2025 Eat Lancet Commission framework, and I'm going to be talking about health, healthy food, environment, justice, and then how can we transform our health, our food system into healthy, sustainable, and just. So we start by healthy diets, and the Eat Lancet Commission conducted literature reviews on the association of diet and health up to 2025. And we reviewed randomized trials and cohort studies mainly, and also some case control studies. And we studied the association of the diet with weight gain, overweight and obesity, diet with non-communicable diseases, but also with the risk factors for non-communicable diseases, such as, for example, heart pressure. The planetary health diet was the result of all these studies, so we came up with the most healthy diet based on whole or minimally processed foods, mostly plant-sourced, and very important that this is not compatible with a ultra-processed food dietary pattern because it's based on whole or minimally processed foods, but also because it really restricts the amount of sugar, the amount of saturated fats that are very, very highly present in the ultra-processed food. So the planetary health diet is based on high intakes of fruits and vegetables, whole grains. So we should move from refined grains to whole grains. Then nuts and legumes as sources of vegetable protein. And then in terms of animal source foods, there is dairy products, about 250 meals per day of milk or equivalent. And then small amounts, but anyway, amounts every day of chicken or other poultry, beef, pork and lamb, fish and shellfish, and eggs. So that this is a diet, a flexitarian diet that allows for about almost 100 grams of animal source foods, excluding dairy products. Dairy products about 250 meals. Then in terms of oils, mainly unsaturated plant oils with some amounts of saturated oils and very, very small amounts of sugar. Now, this is a general dietary pattern for the whole population, and for children 6 to 24 months, we identify that the amounts of animal source food considered here are adequate for most young children from 6 to 24 months. So this diet is not restricting animal source foods for children. Of course, lower amounts can result in nutritional deficiencies, given that children have relatively high demands of several nutrients, of which animal source foods are good sources. So something very important is that the planetary health diet is a guide that should be adapted to local food cultures. So here we have examples from all over the world of different manifestations of the planetary health diet. The Planetary Health Dietary Index is a measure of adherence to the planetary healthy diet. The higher the index, the lower the total mortality. We can see here, every step reduces the risk. But if you are, for example, on the upper decile of the index, then the reduction in mortality is very high, it's 28%. So this shows how this diet is really very, very good in terms of reducing mortality and, of course, morbidity. Here, what we did was to estimate if every person in the world shifts from the current diet to the planetary health diet using planetary health diet indices, we will reduce premature deaths by 27%, which are equivalent to 15 million premature deaths per year. We now move to the food system shares of the planetary boundary. So what is the impact of the food systems on the natural systems of the Earth, of the stability of our planet? And we start here by showing the planetary boundaries framework that defines 9 global interdependent environmental limits within which humanity can safely operate. So as long as we are below these environmental limits, humanity can prosper in a very healthy environment and a safe environment. So these are the planetary boundaries, for example, climate change, land system change, biodiversity. For each one of them, we have control variables, like, for example, climate change, greenhouse gas emissions. And then we identify the food system boundary for the food system. So this is just for the food system. And for the food system, as long as we are below 5 gigatons of CO2 equivalent per year, we are in a safe operating space for humanity. And we have these same limits for each one of the 9 global environmental limits. So these are the planetary boundaries. If you look at the dotted yellow line, this circumference here, above that yellow line, we are transgressing the planetary boundaries, and you can see that out of the 9 processes or planetary boundaries, we have transgressed already 7 of them. In this one, we now present the food system share, and you can see that 5 out of the 9 planetary boundaries are transgressed as a result of the food system, which means that the food system is very important in the transgression of the planetary boundaries. Therefore, we should shift, we should transform our food system so that it is compatible with the health of the planet. So the question here is, can we feed 9.6 billion people healthy diets from sustainable and just food systems in 2050? So we have 3 main variables: what we eat, what we produce and how we produce it, and what we throw away, all the food loss and waste. And the conclusion that I will show you a little bit later on, but the conclusion is that in order to reduce the impact of the food system on the transgression of the planetary boundaries, we should move to a planetary health diet, from the current diet to the planetary health diet. We should shift to sustainable agriculture, so agricultural techniques that are compatible with a healthy environment, that are friendly to the environment, and what we throw away, so reduce the food loss and waste by 1/2. We also have the possibility of applying other mitigation policies, for example, emission pricing, land use regulations, to maintain carbon budgets. So examples: afforestation, renewable energy, bioenergy. So by mixing all these variables, we were able to estimate or to model what will happen in 2050 with all the people that will live in the planet if we continue with business as usual, if you continue eating the way we eat, producing the way we produce, and wasting the way we do. So we're going to be above the planetary boundaries in a range from 4 to 41%. If we move to the interventions of Eat Lancet, shift to healthy diet, reduce waste, and move into ecological friendly agricultural techniques, we are going to be below the planetary boundaries for land, food agriculture, and greenhouse gas emission, and we're going to reduce significantly the transgression of the other 3 systems, but we're going to still be above. So then we use the mitigation policies that I mentioned before, and that will lead to 4 of the 5 systems below the planetary boundaries and 1 slightly above. So there is still, things to do in order to reduce the blue water use. In terms of justice, we are very interested because when you shift the food systems to a new paradigm, you can incur in many injustices. So our justice framework includes distributional, recognitional, and representational justice. Distributional: who gets what and how fairly are resources, risks, and benefits shared. Recognitional: whose identities, values, cultures, and experiences are acknowledged. And representational: who has a voice in the decision-making processes in the food system. And the rights that we would like to comply with are the right to decent work, the right to healthy food, the right to a healthy environment. So here we estimated the number of people who fall short of this social foundation line. In other words, those who do not comply with each of the rights. So on the right to food, 20.8 billion people do not have access or do not have access to affordable healthy diets. They cannot afford healthy diets. 5.6 billion people live in unhealthy food environments. The right to a healthy environment, non-toxic environments, 5 billion live in toxic environments, and 419 million people live in unsafe climates. On the right to decent work, that means people who work in the food system, 394 million do not have a decent wage, a living wage, and 2.6 billion do not have meaningful representation. So we want to make sure that the policies really try to comply, to make everybody comply with these rights. So we move now to the solutions and the transformation of the system. The 8 Lancet Commission developed its own solutions, but I'm going to move to recommendations from Latin America that are very compatible with the solutions and transformation proposed by the 8 Lancet. And I'm going to talk about the Global Alliance for Improved for Children's Healthy Diets, the Latin American and Caribbean chapter, ALSANA, that is an initiative of our National Public Health Institute, the institution where I work, UNICEF, PAHO, WHO, with participation of academia and civil society. It was launched at the 20th Latin American Society of Nutrition Congress in 2023. I was appointed president of the alliance. Our mission is to protect the right of children and adolescents to healthy and sustainable diets, free from foods and beverages that harm their present and future health and that of the planet. Our dream is to have a new generation of Latin American children living in healthy food environments and growing up eating healthy diets. ALSANA proposes 10 policy actions, which are these ones. The first one is promotion of food-based dietary guidelines. The second one is early childhood nutrition. Ensure adequate nutrition in early childhood, particularly making mandatory the International Code of Marketing of Breast Milk Substitutes into a national legislation. Promote healthy eating in schools, which means that in schools should be the opportunity to consume healthy food. Healthy environments for children, transform the environments in which children and adolescents live, restricting access to ultra-processed products and limiting exposure to all types of unhealthy marketing. Regulation of ultra-processed products through actions such as taxes and front-of-pack warning labels that have been implemented now in many countries. Then social programs and public procurement. Ensure that social programs, for example, school breakfast, purchase and distribute healthy foods, preferably from agroecological sources, access to safe drinking water, primary health care in nutrition to prevent and treat all forms of malnutrition, prevention of conflict of interest. This is very important. Establish conflict of interest shielding mechanisms to prevent the ultra-processed food industry from influencing nutrition policies and programs, and nutrition research, data generation, information systems on food and nutrition to help implement the policies. Now I move into the practical experiences in Mexico. Mexico is in the process of building a comprehensive policy package to shift our food system and food environments into healthy, sustainable, and just. We have here a comprehensive policy package, including physical activity, healthy and sustainable diet, healthcare, and we are interested in a sustainable production to ensure availability, cash transfers to ensure affordability, fiscal interventions also for affordability, then for demand and consumption dietary guidelines, front-of-pack labeling, advertising regulations, prevention and treatment of non-communicable diseases, and opportunities for physical activity both at the school level and at the built environment level. We then need to strengthen the legal framework for policy implementation free from conflict of interest. And all of this will lead us to healthy diets for the entire population without exceeding planetary boundaries. This is was published very recently in a book where I am the editor. It's called Obesity in Mexico, Toward Food Systems and Food Environments that are Healthy and Sustainable. And I move to the last one, in which I present Mexico's current policy package to achieve healthy and sustainable and just food systems. I mark here in red circles in our framework all the policies that we have been applying. It includes cash transfers to low-income population in Mexico to allow, affordability of healthy food, taxing sugar-sweetened beverages and unhealthy food, mainly ultra-processed foods, warning labels, including sugar, trans fats, sodium, and calories, and also some other ingredients like caffeine, like NCS, marketing restrictions of unhealthy products to children and adolescents, healthy and sustainable dietary guidelines for the general population and children. And it is important to point out that in Mexico, our guidelines are consider the sustainability aspects. And finally, regulate the distribution, sales, and marketing of unhealthy food in schools. We have recently approved a general law for adequate and sustainable feeding, which is really a law that promotes food system transformation into healthy and sustainable. It is the law is approved and the implementing regulations are still pending. Thank you very much for your attention, and I hope that this is going to be very useful for everybody. Thank you very much.
Thank you. Muchas gracias, Professor Juan, for your insightful presentations, which highlights how healthy diets for children can be achieved by transforming food systems toward sustainable, just, and minimally processed food patterns, supported by strong policies that protect children's right to nutritious food and healthy environments. So now we come to our third keynote speaker. It's my privilege to introduce Professor Rina Agustina. She's a professor of nutrition at the Faculty of Medicine, Universitas Indonesia. Professor Rina is an internationally recognized expert in human nutrition, serving as a member of the Indonesian Academy of Science and WHO stage, as well as an Eat Lancet Commissioner and Follow Ambassador. Her work focuses on maternal and child nutrition, sustainable diets, and public health policy, with extensive contributions to global and national research initiatives. She will present on healthy diets for children and adolescents in Indonesia, evidence, guideline, and policy action. Professor Rina, welcome. The screen is yours.
Thank you very much, Professor Yodi. Let me share the screen. Good morning. Assalamualaikum warahmatullahi wabarakatuh. Today, I would like to discuss how the future Indonesia's health is fundamentally shaped by what our children and adolescents eat. The key question, how we align evidence that we heard earlier with national policy and real-world food environment that make healthy diet the easier choice. This presentation will highlight the problem that we have, the adolescent behavior alignment between global and national dietary guidance, and how it can work together to translate this into actionable policy and food system transformation. As we know earlier from our minister, Indonesia is facing a triple burden of malnutrition, undernutrition, micronutrient deficiency, and rising obesity. Malnutrition, we know that this lead to irreversible losses and really affect cognition, learning, and productivity. They're not separate problem, these three problem, they all coexist and interact each other. And this early malnutrition will actually influence also the loss in cognition, development, and productivity, while poor diet quality, adolescent, accelerate long-term anxiety risk. We face rapid nutrition transition driven by ultra-processed food, unhealthy one, food environment, and also children and adolescents, all are most vulnerable. So here we know that Indonesia has achieved some decline on stunting, but it still remain high with 19.8%. At the same time, if we look at here, the huge increase of the adolescent obesity, it's really a major problem. It means that stunting is declining, but still high overweight among adolescents is rising. So if you look at this slide, this is a slide show the gaps between what people eat and what is recommended. So the malnutrition that we see before is really connected with the driver of the dietary quality. And here across Asia, including Indonesia, if you look at here, Indonesia is Asia, one, we show that it's a consistent underconsumption of protective food like whole grain, fruit, vegetable, legumes, nuts, and seed. But also, although it has a moderate intake of fish, closer to target of many Asian, but have some overconsumption in some countries for animal fat, added sugar, and also the processed red meat. So how is the dietary quality in Indonesia then? It shows these figures clearly that is inadequate across all age group, especially if you look at here, giving an example of adolescent aged 13 to 18 years old. The adequacy may appear somehow acceptable, but we see that they're high inadequacy for the energy and protein, as well as the high energy inadequacy, not only in old age, but also in adult. And if you see here on fruit and vegetable, only less than 5% met the recommended intake. And even, I think the latest one is 3.3%, which a high salt intake among all age group and adolescent. And there's a changing pattern from this age group with the factory made snacks, fried foods, crackers, processed packaged food, instant noodles, and all are increasingly common in our country. For adolescents, food choices are increasingly driven by taste. This is our survey that we did in West Java, showing that how actually their food choice is driven by taste, convenience, and surrounding food environment. In practice, many consume snack such as here their favorite is seblak. Yeah, seblak is like chips that is put it together with some ingredients, fried foods, sweet snacks, and sugar sweetened beverage, often in combination. And there's a lot of high appealing sensational product, for example, gosh noodle or pocheng stick, where strong flavors such as hot and spicy taste become the key attraction. So this actually also shift toward energy-dense, nutrient-poor foods. Importantly, the early habit they have will shape long-term health risks. That quality is not only a matter of individual choice. As we heard earlier, this actually contributed to availability. So it's really on a food system, how food is produced and supply, food environment, dietary quality, with all in terms shape their growth, learning, and long-term health and development. Therefore, improving diet require not only education, But we really have to think about system level intervention that's scalable, equitable, and sustainable. Why we put emphasis in children and adolescents, with increased awareness, children also serve as a power agent to change with their family and broader community. Building on that discussion, if we look at the diet quality is shaped of food system, then improving nutrition is not only health priority, but at national development priority. If you look at here, our Indonesian Vision 2024 clearly emphasize human capital, economic growth, equity, and sustainability. So nutrition play fundamental role across all these targets by improving cognitive development and productivity, to reducing inequality and supporting long-term sustainability. In other words, transforming diets, especially for children and adolescents, is really essential to achieve Indonesia vision by 2045. So if you look at here also, it shows that target 5 on the reduction of gas emission intensity is one of the very important agenda. So our discussion today to combine that together are really in line with our vision 2045. So following this vision, where human capital is central, the question becomes, what guidance do we have to improve diets at scale, especially our children? So we heard already from Professor Huan about the Eat Lancet 2019 and also 2025. There's also, well, health organization emphasize limiting sugar, salt, and unhealthy fat with strengthening food environment. Eat Lancet report adds a broader perspective, really linking diet quality with environmental sustainability through a plan-forward reference diet. And indeed, in Indonesia, Isi Piringku, My Plate, the National Dietary Guidelines already translate this principle, match and actually close to, and somehow some are actually has to be shifting into a simple, practical model and healthier and also more diverse. So we hope that this can be explained, and also the cross WHO Eat Lancet national guidelines, the message is consistent: healthier, more diverse, more plan-forward diet. Professor Huan already mentioned about planetary healthy diet. This is a flexible, flexitarian, culturally adaptable framework and emphasize a strong foundation of plant-based foods, vegetables, fruits, whole grain, legumes, and nuts, while including moderate amount of animal source, where plant foods in daily basis, animal source in weekly basis, like chicken twice a week, beef once a week, fish twice a week, eggs twice a week. Dairy, yes, you can have it or not having it, but if you have it, it's about 1 glass a day. And also, of course, limit all these aspects. So this slide highlight the gap. If you look at the previous slide on the planetary healthy diet from Eat Lancet and how we can put them together between the average diet that children in Indonesia now have and the planetary healthy diet. So this is the, if we're shifting, and this is what the current have, it shows a slide, this slide highlight the gaps between what Indonesian children currently eating and the planetary healthy diet, especially the heavily dominated of the staple food, especially white rice, while the intake of vegetable, fruit, and legumes and nuts very limited. So in contrast, if we look at the recommended diet, it shows that significant shift toward more diverse, plant-based, nutrient-dense foods with more balanced composition across food groups. So there's an opportunity for Indonesia to lead the shipment and looking at what the evidence that might actually as a benchmark for the shifting. So we look at also sugar intake is also a double in the recommended approximately should be lower than the recommended amount. So this is the same also building from the children. We see on adolescent diet in Indonesia, also heavily dominated by staple food, refined grain like rice, white rice, increasing also contribution from fats and sugar. At the same time, intake of vegetable, fruits, legumes, like the children as well. And this is almost similar also in adult, which show that's still very limited. Although the recommendation from nutrition guidelines is actually much closer to planetary healthy diet. So it's clear that planetary healthy diet below show a clear shift toward more diverse, plant-rich, nutrient-dense, and also balanced across food groups. So building on that alignment between global national guidance that we have evidence, and we already heard very huge evidence by Dr. Neha as well as Professor Huan, what we have now in a national level, Indonesia has a strong opportunity because it has a foundation on the National Nutrition Guideline. This guideline emphasizes 4 pillars, not only diet diversity, but also healthy behavior, physical activity, and maintaining healthy food. The Tumpang Gizi Seimbang further translate this principle into practical, cultural relevant daily diet, but we need to have a revisit of these guidelines according to the current updated evidence, but not too far actually to make the change. So this is show that planetary healthy diet, global national alliance with the planetary healthy diet. We look at the planetary healthy diet and the previous one, and how this is appearing too, and how we can shift that. Look at here, it's just an example. This is an example of several menus, like menu day 1. Here we can look at some of the example from the breakfast illustration of the healthy and sustainable diet looks like in practice across the day. Meals are built around diverse, minimally processed food with the strong emphasis on the plant-based ingredient, vegetables, fruits, legumes, and whole grain. So we look at here, we also come from many different cultural perspective, like this is a corn rice from Madura, and also many different pepes ikan, tofu. So we allow also animal product as well as the many fruit and vegetable in many different meals menu. So this is also another example. Gado-gado is very famous in Indonesia, which shows it's a very clear the adequacy of the nutrient as well as the in line with the planetary healthy diet. Okay, so this is the family menu, food like for a delicious Indonesian cuisine. Red rice, pepes ikan, tofu, tempe, cah kangkung, sayur asam, sambal. So this is actually everyday menu that we can look at it, where it is actually very much close to planetary healthy diet. So again, how then we would like to put this all together in family in practical application. So it lines provide the direction more to this, and then we would like to see whether its life course could be also applicable. So in early childhood, it means breastfeeding diverse nutrient-dense foods. In school children, it means providing dietary quality habits. And adolescents, shifting away from processed food toward healthier choice. And of course, this is not about the diet, but also the life course strategy. So applied consistently, it can break a cycle of malnutrition. But of course, we have to start from early nutrition, early life nutrition to better future. So the future of young adult as a preconception and maternal health will be a basis for healthier parents, nurture healthy children, and continuing the cycle for next generation. So this the next slides is about how dietary needs like infants and young children, where rapid growth requirement, exclusive breastfeeding, and develop healthy habit and taste preference as a prevention of undernutrition, obesity, where familiarity with foundational healthy food. So we have optimal nutrition with disease reduction. So this is the some of the compiling different recommendation. Of course, we have to work together from many different sources on recommendation for exclusive breastfeeding, start complementary feeding, ensure variety of food, appropriate portion, and offer clean drinking water, as well as introduction complementary food over variety of local nutritious food. So the Eat Lancet Commission allow this diversity, the local nutritious food, combine it together and avoid, of course, added sugar and high salt product and have a safe food practice. So these actually show that the balanced approach essential among animal source food described in actually if you look at the report in Eat Lancet in table 1 and animal source food suitable for most children aged 6 to 24 months enrich if you look at this one, it's a source that rich in key nutrients like ferrum, vitamin B12, zinc, and calcium. It means that animal source are very much providing these rich key nutrients. Plant-based foods, the nuts, legumes, seeds, vegetables can provide most of the above nutrients. Maybe the caution will be on vitamin B12 if we only plant-based food as a source because its vitamin B12 will be very much from rich key nutrients on animal source food. So if animal source food intake is low, complement the diet with nutrition supplement or fortified food and will help ensure adequate nutrient intake, including vitamin B12 with B12. Yeah. So this is a recommendation somehow for adolescent 11 to 18 years old, healthy diet for people, but also can be for planet where these Eat Lancet commissions show that the recommendation of eat for growth and development, ensure enough energy, protein, calcium, iron, but also choose mostly whole and minimally processed food, based meals on vegetable, fruit, whole grain, include moderate amount of fish, eggs, and limit ultra-processed food, as well as shift toward a sustainable, healthy diet. Eat more plant-based food. So if you know here, half of our plates should be coming from fruit and vegetables, and then half of that is coming from staple and animal and plants protein, so this actually will reduce access also red and processed meat. And support the environmental sustainability and build healthy habit and food environment. So what opportunity we have for policy? If we have all evidence, we have what we have in our diet, these slides show that we have a big opportunity because we have a strong and growing policy foundation to improve nutrition with regulation of health law, PP 28 2024, the expansion of front or package labeling. So for example, this one about the standard and threshold, composition standard, and the labeling and marketing restriction, fiscal measures are actually already in our health law. So this is actually has the basis for academician and also many different researcher to give to see evidence and to support the regulation to boost all these 4 factors. So what we have right now, actually many policy specific and sensitive intervention. So like, for example, we have Makan Gizi Gratis, free national meal program. This is a large scale for those who are coming from other country. This is a huge intervention or program that we have now. These have to be evaluate thoroughly to focus on early life nutrition and targeted population for the remote one. This is huge opportunity to improve dietary quality if it's done in a good management to support child growth, learning, and productivity, and promote local food, local economy, strengthen food system and equity. Just like mentioned by our vice minister, that there's a new regulation on food labeling for ready-to-eat food, for off-package labeling, for mandatory warning label with the A, B, C, D, E. So this is would support healthier choice. So in addition, we have already an existing program from Ministry of Health program. We should maintain this as a basis of the program, evaluate and monitor to really reach the implementation at the Puskesmas, primary health care, posyandu, community cadres for pregnant women, like supplementary feeding, breastfeeding mothers and children. Those need to be maintained. Although we have the National Free Nutritional Meal Program, this has to be worked together, not to eliminate one to another. And other key nutrient program, we know that there's a stunting prevention, micronutrient supplementation, iodine deficiency, breastfeeding promotion, food fortification. All these actually very important opportunity that we have already. So therefore, with all this information that we have, I would like to suggest the priority of action, maybe 5 different pillars. We can dig out more. First, the investment of early life nutrition. So this is highest life stage return as described by many of the evidence. So we have to focus on the first 1,000 days, adolescent as critical windows of opportunity, prevent irreversible stunting, boost future productivity. And there's many evidence from Lancet series about this one, how this actually affect the future generation. And the second, transform food environment, healthy school food policy, district marketing to children from of packaging, improve child weight and nutrient intake, and also promote healthy diet with promote minimally processed food, strengthen local food system, and improve affordability in healthy food. So to save consumption toward nutrient-dense food, as actually so from the previous evidence. And also integrate across sectors, whole of government and whole of society approach health education, agriculture, trade, and social protection. They have to work together. And last but not least, for researcher and also for policymaker, strengthening data and monitoring for action. We have a lot of survey and all like SSGI, SKMI, SKI, and food environment indicators should be strengthened to have also routine monitoring policy evaluation. So the evidence provide this real-time progress, pinpoint disparities, and also can take action. So there's a lot of other health equity and sustainable diet for every Indonesian children, adolescent, hopefully can be achieved with these 5 different pillars of action. So last but not least, I would like to mention that Indonesia is at critical nutrition transition where triple burden malnutrition and dietary change require urgent and coordinated action. WHO, it Lancet, ICP provide a strong foundation for action, strengthening food environment, improve diets, and ensure program reach those who needs the most. Investing in children nutrition today will build a healthier workforce and more previous Indonesia tomorrow. Let's transform the food system. Healthy diets are to become to have a healthy diets as an investment to our children Indonesia future. Every child deserves healthy food. Better diets leads to better health and our learning. Stronger human capital drive economic growth. Together, we can build a healthier, fair Indonesia. Let's act together. And now, thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Rina, for that comprehensive and insightful presentations on how we can align between evidence, local realities, and policy action to ensure healthy, equitable, and sustainable diet for every Indonesian child and adolescents. So now we will proceed to the question and answer sessions. We have been sharing the link, the Google form link for the Q&A. If you still have questions, please write in the Google form link along with your name and institutions, because we'll be selecting a few questions in the remaining time for about 20 minutes to be addressed by our distinguished speakers. And we already have some questions coming in. So we can start looking at the questions. Okay. Now let's start with the first questions. This is from Ulfa from Hasanuddin University and it's addressed to Dr. Neha. So the question is, how can we better understand the relationship between ultra-processed food consumptions and health outcomes across different income settings, given that higher income countries tend to have greater UPF availability and better overall health indicators, and what are balanced strategies which should be prioritized to improve nutritional quality of UPF globally. Dr. Neha?
Thank you very much. And thank you very much for that question. I think the way that the evidence base has built up, just to highlight a couple of things, ultra-processed foods, because they are industrially manufactured, are actually quite comparable across different contexts. So a Doritos, it might be called slightly different, would have the same recipe and the same nutrition composition, whether you buy it in the US or in Asia or in Australia. So there's a lot of actual comparability in the products. And the evidence base is really built on the amount of calories or the amount of servings of these products and their contribution to the total diet. So it really isn't about individual products and how variable they may be in their nutrition composition, but it's the total contribution of all different types of beverages and solids that are ultra-processed foods and their contribution to your daily caloric intake, that and that impact on health, which is what the current evidence base reflects. For those reasons, it doesn't the income level of the country doesn't play as much of a role. It's the contribution of the ultra-processed foods to the diet that does. And I believe that evidence, the higher the contribution to diet of ultra-processed foods, the worse the health impact, carries between contexts. And in terms of what strategies, we've heard from all our distinguished speakers today about the various pillars that we could invest in, start early, generate evidence, focus on the environmental drivers of these products, those, promote real food, just as our topic of the webinar states. And I think those would be fantastic first steps. Thank you.
Thank you, Dr. Neha. Next question. Can we go to the next slide? Okay, it's still being refreshed because questions are coming in. So let's give it a few minutes. Okay, that's coming up. So this one is addressed to Professor Juan. It's from Vidya Sutiya from GAIN. The question is, how can we best frame the business case for the climate, food, and nutrition nexus so that it resonates with sectoral actors such as agriculture, transportation, and the food industry, as well as government financing authorities? Professor Juan?
Yes, thank you very much, Vidya from GAIN. Very good question. So let me just start by saying that humanity is at the crossroad. What we decide and do in the next 10 years will define the future not only of humanity, but of our planet. And it's really an issue of survival of our species and other species. I showed how of the 9 planetary boundaries, we have surpassed already 7 of them. 5 of them, we surpassed those limits as a result of our food system. The food system is becoming very important. So I think that the first business case is really survival of our species and survival of the world that we live in now, a world that has had a relatively stable climate and that has water for all our purposes, that has biodiversity. We can lose all of that as a result of the human activity. So that's a very strong case, not only for business, but I would say for survival. Now, the other issue is that, all actors should be interested in this. Agriculture, because, for example, climate change is already reducing the productivity of several products, corn, beans, a little bit less impact on wheat. And so agriculture would suffer very, very much from climate change. We should really start, having activities that reduce the climate change. Also, the loss of biodiversity can have a very important impact on agriculture. Of course, transportation, that's another source of, for example, greenhouse gas emissions that we should make them understand that this is crucial, that we can switch to energy that do not use fossil fuels. Food industry, the food industry is contributing to disease, is contributing to, part of the deterioration of the planet, and they can be a very important key player. And I think that the case for them is that you can move into a non-processed or minimally processed food, and the food industry can do a lot to make that available. And of course, government and financing institution is the most time we waste without bringing solutions, the most expensive it will be to maintain living conditions in our planet. So those are some of the arguments that we should be using with all these different actors to make sure that we start, switching to a better diet, agricultural production that is healthy with the environment, reducing the loss and waste of food, but of course also reducing the use of fossil fuels and many other sources of the environment deterioration. I hope that this answer is useful, Widya.
Thank you, Professor Juan. I think we have the third question now for Professor Rina. Can we show the question for Professor Rina? So it's actually two questions. First one is, one major challenge in promoting healthy eating, reducing UTPF, because many people choose cheaper UTPF over more nutritious options. What practical and scalable strategies can be implemented to make healthy and safe food more affordable and accessible? And can the MBG, the school feeding program, be a strategic opportunity? If so, what are the key factors that should be prioritized to ensure the program is nutritionally adequate, safe, and sustainable? Professor Rina?
Thank you, Professor Yodi. This is wonderful questions, very important. I would try to answer, but of course, for Professor Juan and Dr. Neha, of course, have experience. Feel free to jump in, Professor Yodi. So in my slide, I mentioned that when we talk about this aspect, this is not just about individual choice. It is about structural and system issue where the food system makes the ultra-processed food the most affordable option. Yeah. So the solution I'm not really sure whether this is practical, but I think could be effective to reshape food environment through coordinated, scalable action. Like one of that is improving the affordability by subsidizing nutrient-dense food and using the fiscal policy. Indonesia is actually already started discussion on sugar-sweetened beverage tax. And the most important question is that if this is applied, how this can be used to improve affordability by subsidizing the nutrient-dense food, maybe to the farmer, subsidy for the farmer, for the retailer, and also for any other production line. And the second, actually, of course, always to strengthen local food system to increase access to fresh and diverse food. Could be also displaying in the food environment how we can see from the retailers. This actually is usually very far, so we can put it also access to fresh, diverse food everywhere, and with the subsidized also if possible, and then use public program like for example school feeding or and to demand healthy diet. So we really have to focus on demand side and also put a lot of potential behavior change strategy for this. So improve food environment through regulation, labeling, availability is already there somehow. That could also be possible to strengthen in system level. And I would also think that would be good to reduce costs, but maybe not in the product that has been sold already, but reduce costs through the innovation in production. And then the supply chain. So this is something that the researcher has to think about. So making healthy diet for the birds require all these system transformation together. Yeah, and aligning also with agriculture, health, education, the economic policy. So the second question is about the MBG. So maybe Professor Juan and Dr. Neha should know that Indonesia apply free meals program widely as scalable. It's a very high contribution from our GDP. So we have to use this as a strategic opportunity. This is as a strategic opportunity. Otherwise, we will lose. So it has to be really evaluated clearly. So it's not about just reduce the hunger, but shape healthier diet, long-term eating behavior at scale. So it has to be starting from early life nutrition, emphasizing on the pregnant women, the lactating, and also under 5, to also impact to have this as a priority, especially in poor society as well as in remote areas. So we can ensure nutritionally balanced, strict food safety standard, integrating continuous nutrition education, aligning broader school food environment if we did in school. But in school, maybe we can look at after. I think the best one is until the primary school where the catch-up growth and also the catch-up brain still there, and also designing acceptable cultural and linking also all the procurement to local food systems. So we should not only think about the supply side, what we have now, but really looking at how this impact the diet quality, behavior change, and also in long term for many different health outcomes. So that's actually my answer. The essence is that MBG or free meals program should be designed as a system intervention, combining nutrition, safety, education, food environment, and should be managed well and monitored very, very thoroughly. That's what I would like to mention. Maybe additional comment from the other speakers.
Thank you, Prof. Rina. Since we only have a few more minutes, I would prefer to go to the last questions, which is addressed to all the speakers. So can we show the last questions? Because it's addressed to all the speakers. It's still being refreshed. Can we refresh it? Okay, it's It's not showing, but I think I can read it from here. So first of all is to Dr. Hanpur, Dr. Neha. So based on some studies done by master students in Indonesia, mother regarded complementary foods of UPF as preferred by the children and practical to serve by the caregivers. These mothers state that providing these foods considered as giving the best for the children. Do you have any similar findings from other parts of the world? That's the first question. And then for Professor Domarco and Professor Rina, based on the grassroots findings mentioned above, what is your opinion about the most urgent system-level interventions to slow down, if not remove, the norm favoring UPF? So, Dr. Neha, you may start.
Sure. Thank you very much for that question. I think this insight is potentially mirrored in different regions of the world as well, where there's something about the marketing and the positioning of complementary baby foods that target the particular vulnerabilities of new parents who, like parents all over the world, want the best for their children. That perception that a packaged complementary food is the best option is pervasive everywhere. But I would argue that if that complementary product was cooked to food safety standards and prepared at home, it would be more nutritious than what was potentially available in the packaged version. It is marketed heavily. There is absolute targeted marketing to mothers of these complementary products. I think that is potentially why people have the notion that this is better for their children, but it is not. If it is clinically indicated and advisable, please continue with promoting breastfeeding where possible, and have your complementary products and meals, much like Professor Arena mentioned. Start early, have them be based on minimally processed foods. Make sure the children have the best start in terms of even their adjustments to tastes and sweetness levels and preferences to texture. All of them, there is so much more to gain from having these guardrails put right from the very beginning than it is to shift to ultra processed foods at the start. Stop there. Thank you.
Thank you, Dr. Neha. Prof. Juan, please.
Yes, so ultra-processed products, particularly those aimed at children, are specifically designed to be hyper-palatable. They are always accompanied by a very aggressive marketing. The aim of these companies are to have lifelong customers, so that children become their customers for the future of their life. These products alter taste thresholds. So, for example, if you provide a kid with those products that Dr. Rina showed that have a very, spicy flavors, then they don't like vegetables anymore. They don't like fruits anymore. So what should we do? The same that we do in order to avoid our children to take drugs. So that is to protect the right of children to healthy foods, of course, through education, that's fine, but then through policies. And the policies are the ones that we have been mentioning, particularly, for example, remove these products from schools, remove these products, particularly when children are young, from the places they live, they play, and also increase the price So reduce the affordability of these products and increase the affordability of healthy products. And then, for example, use schools so that children can taste the wonderful flavors of our, I would say, of our traditional foods. I saw the food that Dr. Rina presented from Indonesia, and I was really about to get up and try to get some of that food because it looks so wonderful. So I have to go to Indonesia just to taste that. But I think that children should learn that that's the best food they can have.
Thank you, Professor Juan. Looking forward to welcome you here with those food in Indonesia. Prof. Rina, please.
Yes, a very important question. Thank you. I learned also from Dr. Neha and Professor Juan. Just to add, complement my the answer, because the question is in grassroots level and in system level. Yes, I think on the grassroots or community level, the most important to rebuild the demand side for real, minimally processed food. So how to do that? Well, it's in many different levels. We can integrate the one that we put it already in the sample to put it as a food literacy into schools. Even from the medical schools, we have to also teach. We already started actually on our medical school at University Indonesia. So we teach children how to, for school children, for example, how to prepare affordable meals using many different ingredients, real food, and maybe combine it with school garden. And this will give a preference early, not just a knowledge, but also they take action. So, and in the food environment, I think that, again, if we go to the school, that how we can implement the healthy canteen policy, restricting ultra-processed food. There's no vending machine should be replaced with the fresh and minimally processed option. So, but the most important, the demand side, yeah. So, and then at the economic level, like I mentioned before about subsidizing nutrient-dense food, we have to look at, for example, what is the most food that consumed by children, adolescent? Can we make it healthier? Or maybe if it's so that can we make we can subsidize that. So I want to give an example. We have like 10 years or 15 years ago or 10 years ago, we advocate the instant noodles company to make healthier instant noodle because it's consumed 40% increase in the last 5 years in Indonesia. It's mostly imported product. So then what happened is that they say that it's really difficult because when we produce that, no one wants to buy it. Yeah. So then later, what kind of innovation that can be made also to make that instant noodle healthier, for example. So those kind of things are really important. Subsidy and also maybe use the tax or sugar sweetened beverage as the way to also Professor Juan, of course, have a lot of experience on that, how to pay that. And system level, of course, regulation. We are happy that now we have a package labeling restriction just launched for the ready-to-eat food, but we hope that we can also have strict for the processed food and also coming up with many different, I don't know whether there's should be also a tax for ultra-processed products. So we have to learn from the other country how this can be aligned together. Yeah, thank you. That's all my compliment answer.
Thank you, Prof. Rina. As we run out of time, let me wrap up this session. So what we heard today is both compelling and confronting. I mean, from the first keynote, the message is very clear. Rising consumption of ultra-processed foods in children's diet are linked to several health outcomes, and that warrants policy action to shift food environments toward minimally processed and healthier diets. From Professor Juan, the second keynote, we learned how healthy diets for children can be achieved by transforming food systems toward sustainable, just, and minimally processed food patterns, supported by strong policies that protect children's right to nutritious food and healthy environments. And from the third keynote, Professor Rina, we learn how to align between evidence, local realities, and policy action to ensure healthy, equitable, and sustainable diet for every Indonesian child and adolescent. Ultimately, food systems are not fixed, they are designed. And what is designed can be redesigned. So if we are serious about protecting next generation, then the transformations we are discussing today is not optional, it's urgent, it's possible, and it must begin now. So with that, please join me to applaud our keynote speaker. Thank you, Dr. Neha, Professor Juan, and Professor Rina. And I will now return the sessions to the Master of Ceremony. Thank you.
Thank you very much, Professor Yodi. Ladies and gentlemen, we will now proceed to the photo sessions. There will be 2 photo sessions, first with all of our keynote speakers and the second one with all of our panelists. Now may we kindly invite all keynote speakers to turn on their cameras and remain on screen. We will take the photo in a few moments. Kindly prepare your best pose. I will initiate a countdown. 3, 2, 1. Thank you. Once more. 3, 2, 1. Thank you. Okay. Ladies and gentlemen, we will now proceed to the next photo session with all panelists. We kindly invite all panelists to turn on their cameras and remain on screen. We will take the photo in a few moments. Okay, I will initiate the countdown. 3, 2, 1. Thank you. Okay, one more. 3, 2, 1. Thank you very much. Ladies and gentlemen, we will now continue to the next session, the policy panel discussion with the topic of improving food environments for children and youth. This session will be moderated by Professor Yodi Mahendra Datta and Professor Rina Agustina. I would like to hand over the session to our moderators, Professor Yodi and Professor Rina. The screen is yours.
Thank you. So from the keynote session, we have heard compelling evidence. We also learned about the system perspective and realities of policy in Indonesia. So if there is one message that stands out, it's that children's diet are not shaped by choice alone, but by the environments which we create around them. And right now, these environments are not always working in their favor. So this brings us to the most critical question. How do we redesign food environments so that healthy, minimally processed foods become the default, not the exception? Because improving diets at a scale is not about asking children to choose better. It's about ensuring that better choices are available, affordable, and protected from competing influences. So through this next panel, we aim to move from evidence to action to generate policy relevance and practical insights that can support Indonesia's efforts to reduce children's exposure to unhealthy food products, promote healthier and minimally processed diets, and ultimately advance equitable access to healthy diets for all children. Now, we are fortunate to have with us on this panel distinguished representatives from government, international organizations, and academia. So those who are not only shaping the conversation, but also shaping the solution. We will begin the sessions by inviting each of our distinguished panelists to briefly share the key points they wish to highlight for around 5 to 10 minutes. So for our first panelist, we are pleased to invite Ibu Dina Kania from WHO Indonesia. Ibu Dina is the National Professional Officer for Policy and Legislation at WHO Indonesia, with over 20 years of experience in policy advocacy. She's been with WHO since 2013, providing strategic, technical, and legal support to governments on health policy development, particularly in addressing non-communicable disease risk factor. Ibu Dina, for the next 5-10 minutes, the screen is yours.
Thank you very much, Professor Yudi. Can you hear my voice well?
Yes, very clear.
Right. So thank you very much. Good morning. Thank you for inviting WHO to this very important event, webinar. I'm truly honored to be part of this webinar and to be here among the distinguished resource persons and panelists. So I'd like to share my key messages with regards to what policy actions are recommended to reduce the children's exposure to unhealthy food environments. So actually, the WHO has recommended several policy actions to improve the food environment and support healthier dietary behavior. We have heard from the previous speakers about these policies, but let me elaborate a little bit more. So the first policy is on nutrition labeling. WHO recommends mandatory front-of-pack nutrition label because it helps people to quickly identify if a product is unhealthy, if they are high in sugar, salt, or saturated fats. It supports informed decision where people can compare products easily, choosing healthier options between the 2 snacks or 2 drinks, for example. There are many FOPL systems globally. There are interpretive systems, which WHO highly recommend, and there are non-interpretive systems, which WHO do not recommend. So examples of interpretive systems of FOPL include warning labels, the one that Chile has, and then multiple traffic lights, the health star rating system, and Nutri-Score or Nutri-Level, which Indonesia has just recently enacted. And to be effective, FOPL must be mandatory because evidence from other countries shows that when the front-of-pack nutrition label is voluntary, the implementation rate by the manufacturer is very low. So again, this policy must be mandatory. Now we move on to the second policy, which is restriction of marketing of unhealthy foods. Children, as we have heard previously from previous speakers, globally and also in Indonesia, they are heavily exposed by this aggressive marketing of unhealthy foods in various platforms, on social media, television, movies, and billboards. And according to the WHO commissioned systematic review, food marketing significantly influences food preferences, purchase requests, and dietary intake. So when these marketings are restricted, it can actually reduce children's exposure to unhealthy food marketing, weaken its persuasive power, and eventually reduce the purchase and consumption of unhealthy foods. So banning advertising, promotion, and sponsorship of unhealthy foods, especially to protect children, is a very essential policy component. Now, the third policy is food reformulation. So what is food reformulation? It is actually changing the processing or the composition of foods to improve their nutritional quality by reducing the salt, sugar, fats, saturated fats, and also eliminates the trans fats. WHO has actually several guidelines to assist countries to support this reformulation, including we have the WHO Global Sodium Benchmark and also the Regional Sodium Benchmark to assist countries to develop a tool to help reduce salt content in various categories of food. Now we turn to the fourth policy, which is fiscal policy. And Prof. Rina has also mentioned earlier about taxes and subsidies. So fiscal policies are very effective. Why? Because they impact affordability of products, right? Governments can introduce excise taxes on unhealthy products, such as sugar-sweetened beverages, and also UPF, ultra-processed foods. And this is to discourage consumption. And at the same time, the government can also introduce subsidy on health products, such as fruits and vegetables, to actually encourage their consumption. And according to the meta-analysis, it shows that 10% of reduction in fruits, vegetables, and other healthy products can actually increase their consumption by approximately 12%. So if you reduce the price of these healthy products and make them cheaper, people will actually consume them more, which is very good. That's what we want. And on the other hand, when we increase the price of unhealthy products, such as sugar-sweetened beverage or ultra-processed foods, and make them more expensive, it can actually reduce the consumption by 6%. So many countries, for example, have introduced this SSB tax policy globally. According to the WHO latest report, we have about 105 countries in the world, including ASEAN countries such as Brunei, Thailand, Malaysia. And there are also countries that have introduced excise taxes on UPF. Colombia, for example, where under its tax law explicitly imposes excise tax on ultra-processed foods and ultra-processed sugary drink. So this is something that Indonesia can also consider. Now, the last but not least policy option is the school or institution-based interventions. And these include establishing meal standards that are being served in schools. We heard again from Professor Rina about free nutritious meals program, or MBG, in Indonesia. And we have to develop a standard for these foods that are served in the MBG. No UPF should be allowed. No sugar-sweetened beverages should be allowed, as well as other foods that are high in salt, sugar, and unhealthy fats. Now, other interventions of the school and institution-based interventions can also include healthy school canteen, cafeteria policies, as well as establishing standards for meals that are being served in the workplaces, for example. Now, in the context of Indonesia, I think you will hear later from our government counterparts from MOH, Indonesia has actually adopted some of these measures in the government regulation number 28 of 2024, which is the implementing regulation of the health law. WHO actually played a role in adoption of these measures, where we provided our technical and legal support during the drafting. So we have these regulations in place, the mandatory front of pack labeling. We have the reformulation there as well. We have marketing restrictions. So now the focus should be in implementation of these measures, because we don't want this to be just written on a law. It won't mean anything unless these provisions are being implemented on the ground. You've heard earlier from the Vice Minister of Health, Professor Dante, that MOH has recently issued a decree on Nutri-Level. Nutri-Level is one of the FOPL system on beverages. So congratulations for Indonesia. But bear in mind that this decree is still voluntary. So Indonesia must consider to make it mandatory in the longer term, because if it's voluntary measure, it's not going to be effective, right? And then secondly, it must also be evaluated whether this Nutri-Level system is actually effective to the Indonesian consumers. Now, the second one that is urgent for Indonesia is again to accelerate the enactment of SSB excise tax. This has been pending for so many years. We have actually WHO started in 2008 to advocate for this policy. We have come very close where the government is planning to develop a government regulation on SSB tax and planned to issue it last year, but it didn't happen because of political pushback and because of industry interference. So again, we must then work together to ensure that these policies will be enacted, will be implemented. And there are a lot of industry in the food industry interference, which derail or stop this process. So I think I will stop here, Professor Yuda, and I'll hand it over back to you. Thank you very much.
Thank you, Ibu Dina, for sharing with us the WHO policy recommendations to improve food environment, as well as some additional comments on the current policies which are emerging in Indonesia. So now we will move on to our second panelist. Our second panelist is Mr. David Koloza, PhD. So he's a nutrition specialist at UNICEF Indonesia. He's leading the food systems program to promote healthier food environments and prevent obesity and non-communicable disease. He previously worked with FAO on global food systems and food security initiatives, and he holds a PhD in global health and social medicine from King's College London and the National University of Singapore. Mr. David Koloza, welcome, and the screen is yours.
Thank you so much, Professor Yodi, for the nice introduction. Selamat siang, everyone. Thank you also for inviting me today. It's really a pleasure to be part of this timely and very important event. And I was really pleased to see the presentations from the panelists, as well as just now from Ibu Dina. I have just a few slides that I'd like to use to support my advocacy highlights. And thank you very much to the moderating team for helping me to share the screen. Yes, I think we can go already on the next slide. So I have, as I mentioned, just a few slides that I should manage to cover in about 10 minutes, and I hope the contents will really sort of complement and speak to what has been presented by the panelists in terms of global level data, as well as the advocacy point just highlighted now by Budina. So this first slide, I just wanted to include it because it highlights really the role of UNICEF, not only in Indonesia, let's say, but worldwide as an evidence-based organization. So we do really put a lot of emphasis on research and evidence generation to support key policy advocacy across sectors. And of course, today we're speaking about food systems and food environments. Our key policy advocacy points are really aligned with what the World Health Organization recommends in terms of best sort of practices and policy tools for the prevention of obesity and non-communicable disease. So in the next few slides, you will see and you will hear a little bit about our research around our priority policy areas, which is front of pack labeling, unhealthy food marketing, taxation of unhealthy products, and also, of course, school food environments as they're relevant for children. In general, let's say, obesity strategy and plans. We also, of course, use this evidence for the sort of to support programs. So we have lots of school and health system-based programs. I will not cover these today, but I just wanted to give these broad level, let's say, picture to sort of frame the role of UNICEF in this discussion. Next slide, please. Yes, so this first slide presents a study that we released earlier this year related to front-of-pack labeling, which, as I mentioned, is one of our advocacy priorities. The rationale, of course, was the growing momentum for interpretive front-of-pack labeling in Indonesia. And of course, as you've heard from multiple speakers today, the recent decree on the Nutri-Grade is a very, very welcome addition to the sort of suite of policy tools that Indonesia has for obesity prevention. We still lack evidence of the effectiveness in the local context, and so we sort of decided to partner with the Ministry of Health as well as BPOM, the Indonesian FDA, to develop a study that really tried to understand how different labels, including the current non-interpretive label, the GDA that we have here in Indonesia, as well as other four that instead have been used in different contexts across countries, and really see whether these labels would help in the Indonesian context to sort of help consumer make healthier choices. I don't have time, unfortunately, to go really into the details of the studies that I'll present today, but I've left here links in case you're interested in learning more. But here I just wanted to highlight that in this experimental study, what we saw confirming the global evidence is that all interpretative labels perform best than the GDA. So than the non-interpretive label. We highlighted too the multiple traffic light label and the warning label as the most effective across the outcomes that we saw. The multiple traffic light label in this sense not only sort of helped consumers make healthier decisions on these experimental, let's say, food purchasing exercises, but they were also associated with the highest sort of preference from consumers, so in terms of acceptability, in terms of helpfulness, and so on. So in this sense, and again, I'm speaking about these as the new decree has just been released, the NutriGrade is really a welcome addition to what we have here in Indonesia, because it, as the multiple traffic light, it combines a visual element, so a traffic light element also with specific information on nutrients of concern. Next slide, please. Yes, the second area that I wanted to cover is unhealthy food marketing, and we've heard a bit about it from the panelists in terms of why globally this is really a priority issue. Children, of course, and adolescents are particularly vulnerable because of, let's say, their high exposures to marketing, not only in real life, so for example, in school settings, around schools, but also online. In 2024, to understand a little bit better the situation here in Indonesia, we developed a survey that was disseminated through the YouReport platform, which is a UNICEF tool to sort of share questions on key issues related to children's rights and understand the perspectives of children, adolescents, and youth. This survey was specifically targeting the issue of unhealthy food marketing, exposure, and influence. And the results really highlight, I think, the scale of the issue. So, for example, 3 in 4 of the children and youth interviewed reported often or always seeing ads for unhealthy ultra-processed foods. Most of them also reported seeing these ads with sort of a persuasive element in the sense that they were shared by prominent athletes, celebrities, or others. So really the issue of sponsorships. 2 in 3 also reported strong influence from the ads, so reported wanting to purchase the advertised unhealthy ultra-processed foods after being exposed to the ad. And also, interestingly, 3 in 4 reported seeing these ads either on social media or the internet more generally, which really highlights the new, not very new, but the more recent and emerging issue of digital food environments. Based on these last findings, so on the prominence of online food environments on sort of influence related to ultra-processed food consumption, we conducted last year a study that really specifically looked at the use of social media by leading food and beverage companies in Indonesia to promote unhealthy products. And our objective was, first of all, to understand the type of techniques that companies use to disseminate these ads, but also to assess the healthiness of products advertised against the WHO Southeast Asia nutrient profile model. So again, I think I can say that the results really highlight the concerning issue that we are facing in the sense that, first of all the persuasive marketing techniques that we were studying were found across the 3 social media platforms examined with similar frequencies. But on top of these, 85% of the brands promoted at least one product that was deemed not suitable for advertising to children based on the Southeast Asia nutrient profile module, in the sense that these products exceeded many times by quite a lot the nutrient threshold set by the nutrient profile modules for fats, sugar, sodium, or total calories. Next slide, please. Yes, the third piece of evidence that I wanted to share with you is, of course, something that is at the core, let's say, of UNICEF's advocacy and programming work in Indonesia and worldwide, and relates to school food environments specifically. So, of course, the issues of ultra-processed food, as I just mentioned, it's broader than schools, but schools are really where children, of course, spend a lot of their time, and they're really the foundation of their education as well as their dietary behaviors and their lifestyles. With this study that we released last year, we were examining school food environments in schools across Java, Sulawesi, and Papua. using the tool that you see pictured here, the Nutrient Environment Assessment Toolkit for schools. And we really looked at 4 interconnected environments. So first of all, the provision of nutritious foods. So the study was conducted actually before the implementation of the MBG. So in that sense, there was still an uneven coverage of meal programs, which remain very much individual initiatives implemented by schools, but without comprehensive coverage. We also saw that most schools did not have adequate food preparation facilities or properly trained staff. In terms of the school food environment proper, there were no written policies governing food environments, with only some of the schools having some verbal regulations in terms of, for example, what foods could be sold or not sold based on nutritional criteria. And then, interestingly, but not surprisingly, unfortunately, just very few schools on their own initiative restricted the sale, for example, of sugary drinks or other unhealthy snacks. Many of the schools also did not restrict the purchase of products outside school grounds, of course, increasing exposure of children to unhealthy products, for example, from street food vendors, convenience stores located around the schools. And on top of these, only about half the school had offered clean drinking water on the premises. In terms of nutrition services, most of the schools did have some growth and nutrition assessment, but only half of these had links to the local community centers, the Puskesmas, and the links in terms of referral were particularly absent for overweight and obesity-related issues. Finally, in terms of infrastructure and staff, half of the schools did report having nutrition education trained teachers, but the percentages were very much lower in the schools observed in Sulawesi and Papua. And only about 1 in 4 of the schools met the WHO recommended 60 minutes of daily physical activity, highlighting, let's say, the other sort of issue related to childhood obesity at local level. Next slide, please. Yes, this 4th piece is a bit of a broader, let's say, advocacy piece that I think underpins everything that I've presented so far. So it's related more to documenting the cost of inaction on childhood obesity. Apologies. Apologies, everyone. There's been a power outage in the building. So this study presents the cost of inaction on childhood obesity in Indonesia and really looked at quantifying these costs, looking both at direct healthcare costs, but also reduced educational attainment, productivity loss, so really all the lifelong implications of childhood obesity. We used a simulated cohort of about 43 million children, and on top of these also estimated the return of investment of a package of food environment policies, including all the ones that we've discussed today. So the sugar, sweet and beverage tax, the front of pack labeling, and marketing regulations. So first of all, in terms of cost of inaction, we estimate that only looking at these cohort of children, so not looking at all the future children, let's say, that might experience childhood obesity, we're looking at a total lifetime economic cost of almost 300 billion USD. Or about 0.3% of GDP, of the Indonesian GDP every year. And also, perhaps more interestingly for the conversation today, in terms of return on investment of these policies, we're looking at lifetime savings, again, only from this cohort, of approximately $15 billion if this package of policies is implemented, but also importantly, 2.5 million of averted disability-adjusted life years, and all of these at a relatively small cost of about 0.3% of the Indonesian health budget. So this translates to about a return on investment of about $135 per dollar invested, or $322 saved per child. Next slide, please. Yes, this is my last slide, and it presents the results of a legal landscape analysis that we have conducted to find, let's say, legal entry points to strengthen all the policies that I presented so far. Perhaps I will not go into too much detail because I think my time is about to run out. But just to highlight that the Presidential Decree 28/2024 already offers a strong legal foundation for these policies, as Budina mentioned. What is key is now to accelerate implementation and also to ensure that, first of all, we support multi-stakeholder coordination because these policies are really cross-cutting across sectors. We make these policies mandatory, especially in the case of front-of-pack labeling and marketing, and we also protect them from conflict of interest and industry interference. Thank you very much. Over back to you.
Thank you, Pak David, for the overview of the recent evidences for policy advocacy on front of pack nutritional labeling, unhealthy marketing, school food environment, the cost of inaction on child obesity, and last but not least, that comprehensive legal landscape analysis. So next, we would like to invite our third panelist to share their key points. Our third panelist is Ibu Ais Ratnasari. She's a technical expert for human development and nutrition at Bapenas, with expertise in public health, health system strengthening, and population economics. She has extensive experience in policy development, including national nutritional programs, and works closely with government, international partners, and academia. Ibu Ais, welcome, and screen is yours.
Oh yeah, good afternoon, everyone. Thank you, Prof. Yodi. Can you hear my voice well?
Yes, very clear.
All right. Let me share my screen first. Or maybe my friend can help me because there's some trouble from my side.
Okay. Can someone assist in sharing the screens for Ibu Ais? From the organizer, do we have the slides to share?
I guess I have an unstable internet connection, so let me turn off my video first, Prof.
Yes, please.
Yeah.
It's coming, and please proceed. You can speak while waiting for the slide.
All right.
Yes, it's there. We see it now.
Yep. All right. Yeah. Thank you, Prof. Jody, and all of the community that give another opportunity for me in representing my director to present our policy related to the food and nutrition in Indonesia. Currently, we are in the ambitious target to achieve our ultimate goal for the next 2 decades to ensure the golden Indonesia into 2045 that require a strong investment in human capital, and we aim to achieve the improvement of human capital index and also the reduction of the stunting prevalence by the next 2 decades. And all of that, the goals need the and the strong investment in basic services, human capital, as well as the social capital, which nutrition assurance or nutrition policy is one of the hard, the main intervention of our investment. And that the long term agenda has been translated into our national midterm policy for 2025 to 2024, which we have five big policy agenda, which is three of them has close related to the nutrition intervention. We are eager to improve public health and nutrition for every life cycles, as well as providing our flagship program that we called Free Nutritious Meal Program, and also cultivating a healthy eating behavior and also lifestyle. And those intervention hopefully could contribute to the improving and strengthening our quality of human capital. And we also understand and realize that Indonesia facing a complex of the unhealthy eating behavior and also affordable nutritious food, which drive the non-communicable diseases incidence, and also the number of obesity. And also in the other hand, we also feel we also stand in the second highest hunger in the Asian region. And this is our one of the challenges that need to be handled is the low intake of nutritious and various food that currently for very expensive for for more than 30% of people in Indonesia. And we also consider that the high intake of sugar, salted, and also fat product, it's really drive our epidemiology pattern in Indonesia to being more non-communicable diseases. And one of the factors that influence to the unhealthy diet is the presence of the ultra processed food in Indonesia, which seems increase every year, and many food environment getting unhealthy, and also the low literacy of the people to make a choice which food that more nutritious than other, and also how to maintain their healthy eating behavior. So that's also our challenge to ensure the quality of intake for every people. And we also realize that the health, the nutrition status, it's not only specific in the nutrition or health area, but also need the strong ecosystem and environment to ensure the conducive situation for all the people. And this is our strategy to translate our long-term as well as a midterm planning to the thematic action plan we called RAN-PG, or our National Action Plan for Food and Nutrition. This action plan is still finalizing to be revised. It's because of it's because some area will be strengthened, and also ensure refining how the linkages between one a nutrition system to other sector that could be affecting to the nutrition status. And in this national action plan, we also developed four pillars or four strategic goals to ensure the viability, affordability, as well as healthy consumption for food and quality of nutrition that really need a strong institution and governance in implementing the policy into the local level. And some strategic action, as another speakers mentioned, we also eager to strengthen our nutrition surveillance, as well as the capacity of our primary healthcare staff to deliver the integrated health system, and also strengthening the nutritious labeling, as previous speaker said. We have the new policy to enforce the industry to give a label for the food products. And also we are encourage the community leader to involve in the implementation part of the food and nutrition policy. And as I said before, that we cannot working together to provide nutritious, balanced diet, and also provide them stable food for everyone. So in this national action plan, we also we are focusing on refining of the action and strengthening the linkage between between other system that could be affecting the food and nutrition system, like environmental, climate sensitive intervention, health system, social protection system, and as well as the water system. And this policy hopefully could increase the number of food security index, reducing the undernutritious prevalence, reducing the greenhouse gases, and also the reducing the economic loss due to the climate change. And hopefully from this framework, we can improving our intervention for nutritious food environment, as well as to mitigate the risk of the exacerbating climate change in this current situation. And that's all for me. And we also believe that this intervention cannot be stopped here and need the strong collaboration for multiple stakeholders to ensure the nutritious food for all people in Indonesia. Thank you.
Thank you, Ibu Ais, for that comprehensive overview on nutrition policy in our national development context, particularly the last part, the strategies to sharpen the action plan for prevention, management of obesity and overnutrition under the draft Ran Pangan dan Gizi. So now we will proceed to the next part of the panel sessions, which will be led by Professor Rina Agustina. So Professor Rina, the screen is yours.
Thank you very much, Professor Yodi, for guiding us from the keynotes, presentation and discussion so far, and also the three panelists. So thank you once again. We will now proceed to the next session. I will take over the next session of moderating. So we will invite Mrs. Dr. Siti Nadia Tarmizi, Master of Epidemiology, Director of a Non-Communicable Disease at Ministry of Health, and medical doctor with Master of Epidemiology from University of Indonesia. She has held various key leadership roles in infectious disease control and public health, including serving as the government spokesperson for COVID-19. She's very famous at that time, always appeared on the TV. And the G20 health track, yeah. Dr. Siti Nadia Tramizi, the floor is yours. I understand Dr. Nadia is already present. Yeah. Is there any presentation for Dr. Nadia? Dr. Nadia, would you share some thought and also comment or maybe update on the recent published regulation as well as the other topic related to that? If there's no PPT, that's fine. Would you like to give some insight on what happening now with the current policy at Ministry of Health related to food labeling as well as the front of package aspect? Yeah. Okay. Yeah. Okay. Maybe we need more time for Dr. Tarmizi, so we can go to the next one. Our next panelist, Mr. Ibnu Buniman, MSc. Yeah, he's the program manager on nutrition and environment at GAIN, Indonesia, with over 11 years of experience working on food system. He's currently a PhD candidate and holds a Master of Science in Wageningen University, and also working very much related to this particular issue. Mr. Ibnu Budiman, the floor is yours.
Okay, thank you, Prof. Rina. Thank you also for the organizers for inviting us again, Global Alliance for Improved Nutrition. Today, please allow me to share the perspective from GAIN about one of the policy instruments that have been mentioned a couple of times by previous speakers in order to reduce the consumption of the ultra-processed food in Indonesia, which is the front pack nutrition labeling policy. Is my slide visible?
Yeah, we can see it there.
Okay, thank you. So actually talking about the food labeling policies in Indonesia, this has been a long time effort actually, since we had the government regulation in 1999 on the food labeling and advertising. And then it took us more than 10 years until in 2013, we finally have the regulation from the Ministry of Health on the inclusion of information on the sugar, salt, and fat content on the processed food. And then it took us again about 4 years until BPOM, or the Food and Drug Agency, finally issued the subsequent regulation to implement the nutrition labeling on the food industries in 2019, and finally we had the healthier choice label in the some of the processed food. And then in 2024, as mentioned also by Prof. Rina before, that finally we had also the government regulation that trying to revisit the health messages and also the front of pack nutrition labeling connected to the sugar, salt, and fat information on the ultra processed food. And then, as mentioned before by the previous speakers, that just a few weeks ago, finally, we had the regulation from the Ministry of Health to implement that front of pack nutrition labeling, that trying to limit the fat and salt and sugar components on the processed food. So we have changed the type of nutrition label or front pack nutrition labeling that we are using from healthier choice level to the Nutri level or Nutri score type of level. However, we are still waiting for the regulation from the BPOM, or Food and Drugs Agency, as mentioned also before by the previous speakers, to implement this new Nutri level or new nutrition level in the ultra processed food. BPOM informed that the implementation or the early phase of implementation of this Nutri level labeling will be implemented on the sweetened beverage or minuman manis. And then, however, also that the early phase is still will be voluntary, not yet mandatory, because BPOM will need to harmonize a couple of regulations, and then it said that the transition phase may take 2 to 5 years to finally perhaps we can have the mandatory front of pack nutrition labeling on the ultra processed foods in Indonesia. So it has been more than 25 years journey to achieve to this point, and then we might need more than 5 more years to finally have this nutrition labeling to be mandatory in the ultra processed food in Indonesia. And then if we look at the other examples in other parts of the world, actually there have been 40 countries in the world that have adopted the front of pack nutrition labeling in the ultra processed food, and then 20 of them actually have made it mandatory for their ultra processed food distribution in their country. So this should be a motivation maybe for Indonesia to accelerate the transition toward the mandatory the front of pack nutrition labeling. And then, as mentioned before, also from the study from the UNICEF and also in our study, we found that actually in middle-income countries, the warning label, one of the types of the labeling, actually have been proven more effective compared to the other types of the labeling. And which is this warning label is a different type of labeling that we have in Indonesia. In Indonesia, we had before the healthier choice label, and then now we have the Nutri score or Nutri level label. And these are 4 of four different types of the nutrition labeling that have been implemented in different parts of the world. The first one is the nutrient-specific labeling. And then we have the endorsement logos, which is the one that we had before with the healthier choice logo. And then now we changed that to the Nutri score or Nutri level type of labeling. And then the last one, we have the warning labels that actually more firm in delivering the message that's saying that this food is not healthy, and the children should not consume that. And yeah, and then it brings me to the key message. So there was a question about can market works without the regulation? The answer is no, because especially for the healthy and affordable diets in Indonesia, it requires regulation to set the rails, and then the markets will be able to run the trains in the trails. And to run the trains faster, so we need to accelerate the transition toward the mandatory front-pack nutrition labeling, as mentioned also by previous speakers, and we hope that the transition toward mandatory can be accelerated, and not only to the sweet beverage, but also to other types of ultra-processed foods. And then next, we expect also there's a joint efforts to monitor the implementation and evaluate the effectiveness of this new Nutri-level label that will be implemented. And then last thing is, as mentioned before, also that this regulation also needs to come together with the increasing efforts to improve the consumer literacy on nutrition. And especially now we have a large program on the school meal program, or MBG, that have been implemented in many regions in Indonesia. This should be a good avenue also to inform the students about, especially about this new front of pack nutrition labeling. And then I think that's all from our side, Prof. Rina. You can read the full policy brief in this link, and also you can find it in the link of the slides from the speakers. Thank you, Prof. Rina.
Thank you very much, Mr. Ibnu Budiman, for your valuable insight. Thank you to make it clear, to highlight the important point that Indonesia already has a regulatory foundation. The real challenge now lies the implementation and also effectiveness. Okay, the next one, we would like to invite our panelists talking in the area of social science. We have very much talk about health, nutrition, food related. So we have Indonesian Academy of Science member, Mrs. Supra Wimbarti, PhD psychologist. She's a psychology expert with over 38 years experience in lecturing, research and international training. A lecturer at University Gadjah Mada, and was recognized as one of the top neuropsychology research in Indonesia 2025. Mrs. Supra Wimbarti, the floor is yours.
Well, thank you, Prof. Rina. Let me share to you my PPT. I hope you can see this clearly and you can hear my voice.
Yes, we can see it clearly and also hear your beautiful voice.
Thank you once again. Thank you for Professor Rina, and Assalamualaikum warahmatullahi wabarakatuh. I would like to thank the committee for inviting me, the only non-health person. And I would like to present to you the core of psychological domain and behavior that affected by UPF, particularly. Sorry. Actually, there are more than 5 points from psychology and behavior that will impacted by UPF, but I choose the salient points, 5 salient points, which are attention and concentration, motivation and reward sensitivity, and behavioral patterns that leads to habit formation. Also, social functioning of the kids, about the family and mental health, what type of this, and I hope it will lead to policy impacts. I will see it from research and also research from abroad and my own research several years ago, and also my observation, especially to schools around special region of Yogyakarta. Let me start with the first side, which is attention and concentration. This is about cognition, and probably all of you are familiar with the research from OECD regarding the PISA. This is research globally to the 15 years old youth in the 3 areas, which is math, reading, and science. I don't want to give you all the bulky data, but I choose one, which is mathematics. And I also want to share with you that the 3 domain, math, reading, and science, are the foundation of a nation if we want to develop our technology. So without good young people that have these 3 competencies, so we cannot dream that we will skyrocketing in terms of technology development. So I compare here Indonesia in terms of math ability with Singapore, Vietnam, Malaysia, and the OECD average in math. So Singapore is the highest, exceeding the average OECD in math, and Vietnam is slightly higher. We see that in math, the OECD average is 472, and Vietnam is just right at that point. Malaysia a little bit slightly down from the average, and Indonesia over the years that we joined the PISA measurement, we never achieved the average. So at one time, more than 10 years ago, we were the 3 worst countries in PISA scores. So, and how this is impacted also by the consumption of the children. This is taken among the 15 years old, which is now in the secondary school. And those people, those children who consume a lot of UPF, they usually at school experiences sleepiness and less in attention, and they cannot concentrate fully a lot of times. And this is not because they don't have the capability to concentrate or to put the attention. It's not the capabilities, but with consuming a lot of UPF, then the attention and concentration is up and down. So we can see that if students are up and down in the concentration and attention, they cannot do the academic learning smoothly. And some of them are dropouts. they lost the class hours frequently, and I don't have the data. Those students, no, not students, those youth and children who are on street, whether they also consume a lot of this kind of food. There's no data in my side. And I also want to share with you the reward sensitivity and motivation. Consuming the UPF, it gives the fast and intense rewards, because consuming the salty or sugar type of food, then it gives us the pleasure. It's not only for the children and adolescent, but also for us, the adult people. So with this pleasure principle, this will shift motivational patterns from effort-based rewards that we have to wait to have a meal, a good meal at home, at school, but to immediate gratification, because in the canteen, because in our home, to find the UPF food is very easy. Some household, they put the UPF snacks that are easily taken by the kids. So in the educational setting, we have a problem with reduced persistence. And we know that academic field needs persistence. How to finish the reading, how to finish the math, how to finish other activities. It needs effortful tasks. With the jumping in of the processed or ultra processed food, then the reduced persistence could be down because of the pleasure principle basis of the fast and intense reward given by the ultra processed food. So because of that, then we can find that in school, students have lower engagement academic activities. Some teacher might see that this kid, they don't prepare for schooling, they don't have breakfast, they are lazy, and they fall asleep very easily, even inside the school. So UPF also lead to automatic eating behavior. It's kind of habitual and less conscious. So with the seeing of the processed food, then without thinking, in front of TV, in front of their smartphone, they can automatically eating this kind of food. So this is a shortcut of fulfilling what they want. So the important thing also, the cue-driven consumption patterns, that food, snack UPF food is everywhere, easily get taken, and then the advertisement on the billboard, in TV and our smartphone, and also because of the emotion that probably kids and adolescents, they have negative emotion. They will consume the UPF that make their mood bright again. So this is the queue of information loops, that because of the queue, kids consume the food and then feels the pleasure. So this loop will be, it will go viraling over and over again, becomes the habit in the family. So children actually do not only learning what to eat, but also how to behave in relation with food. If there's no regulation inside the family or at school with their cafeteria, so the reinforcement loops will going on and on. So I very appreciate the the points from the previous presentations, and my suggestion is minor, and in the level of the bottom line, because these habits could have a long-term behavioral templates and very negative for the school achievement. So some of the often overlooked impact is on the parent-child interaction. Some parents regulate the children eating very harshly, for example. The children resist this negotiation and the resistance of eating good food in the family. And this is also can going on and on. And sometimes for the under 5, the parents or the mother put the child and give the food with wandering around the neighborhood. So eating is not on the dining table, but it could be everywhere. This is a kind of a lack of self-regulations. And during our time, our life, we need a self-regulation, an emotional regulation, a routine for the family chores, also including eating habit. So the patterns of family functioning include the increase of conflict around eating, usually between the babysitter and the kids, and the ibu, the mother with the kids. And sometimes parents use the food as emotional coping. Not only the parents, but if children are in tantrums, so they give food that would release them. So some consequences include the duration of mealtime. Sometimes kids consume more than 1 hour to have one meal, lunch, for example, and they put the food, whether they like it or not, inside the mouth for exceeding normal time, and eventually they might also get dental problems. So in terms of mental health, here I share with you with the systematic literature review comprising 25 studies from 32 countries. And what I found there is that according to WHO, 1 in 7 adolescents aged 10 to 19 years experience a mental disorder. The 3 of them are depression, anxiety, sleep disturbance. And also suicide and attempted suicide is prevalent among the study. And the one that hit the neurodevelopmental disorder is or are the attention deficit hyperactive disorder, or ADHD, and autism spectrum disorder. And my study in special region of Yogyakarta, the prevalence of ADHD is 8.09%. And in the world, the ADHD prevalence range from 4 to 12%. And so I think Indonesia, or particularly in Daerah Istimewa Yogyakarta, this prevalence is alarming. And among the school children, according to my research, so ADHD and autism is high in prevalence at school, but the matter is the parents and teachers, they not quite understand the reason. That the reason is relate also with the food they consume, that the children consume. So my proposed that could be used for the policy implementations and probably sharpening the regulation that already been proposed by previous presenters is about the school environment, about the parent education, public messaging, and cross-sector integration. Of course, schools, family, they cannot work alone. But for example, in the school environment, we need to, this is just the same as the previous presenter, that we need to regulate availability of the ultra-processed food. The regulation should be initialized by the food education, because as my experience with schools in Jogja, parents or teacher and schools, they don't understand what is ultra-processed food. And also promote the structured eating patterns. And as the previous presenter also said about MBG and also National Nutrition Agency or BGN, I think both can be the entrance of implementing the policy regarding the UPF. And parent education is not only about healthy eating, but also the healthy eating is related to the self-regulations and behavioral patterns. For public messaging, I think can be about isi piringku, for example. It can be distributed, the education, through what we have in the community, like dasa rumah in the neighborhood. And the message is not only from junk food causes obesity, but we teach them that diet shapes behavior, good behavior, bad behavior, about self-regulation, whether they can have an attention problem, concentration, and so on. And this leads to a good learning. So parents can be educated through these ideas. And of course, again, that this should be integrated cross-sector, that stakeholders like the government, the schools, and the family, community leaders should take action now. So my last closing statement is, from a psychological perspective, ultra-processed foods are shaping how children pay attention, regulate emotion, make decisions, and this will lead to the adolescents and adult people that would have the fine development of these matters. So the effect of UPF, it's not short-term effect, but it goes along through the developmental pathways from childhood to the adulthood. Thank you, Professor Rina. I think my message stops here.
Yeah, thank you very much, Mrs. Supra, to highlight this, to reinforce that ultra-processed food are not only about nutrition or nutrition concern, but also mental health and developmental issue. You're showing the evidence link with poorer behavior pattern, attention, and even increased risk of mental and neurodevelopmental disorder, factors that ultimately affect learning, well-being, and long-term human capital. Thank you very much. So we will proceed for the next presentation. Yeah, we will invite the next panelist, Mrs. Siti Nadia Tarmizi, MD, EPIT. This is, I already mentioned earlier, she's the Director of Non-Communicable Disease at Ministry of Health, MD with Master of Epidemiology, and has various key leadership role in infectious disease control, previous one, including serving as a government spokesperson to COVID-19 and G20 health track. Dr. Nadia, the floor is yours.
Yeah, thank you, Prof. Rina, Prof. Yudi, and all the IP members. Thank you for inviting Ministry of Health to have our perception regarding the how really the diets for child and youth health. I saw there is a David. Sorry, David. Maybe some of my slide showing the UNICEF study, but maybe later you can explain more detail how the issue in term of what food affects to the child and the youth health. Okay, so please the slide. Prof. Rina, because I'm on the way, maybe it's better for me to close my camera, yeah? Is it okay? Yeah, okay. Yeah, please, the first slide. So I just, it's already been spoken by the previous, our speakers, and then from the government side, we all agree that we need to protect the children and the youth, behavior. We see here from the data, there is a trend on the childhood overweight and the obesity in Indonesia from the data in 2013, 2018 up to 2023. We see the overweight is increasing like 12%, but there is slightly obesity is decreasing 7.8%. But we have to keep in our mind the absolute number will be almost the same with the percentage in 2018 of children below 12 years in increasing too, because the size of the population is increasing. So we see there is a experiencing of Indonesia in nutrition transition with the increasing of the consumption of the ultra processed food, UPF, that already been presented before, especially this UPF contained with the high sugar, salt, and the SSF. And we see the burden of the overweight and obesity as a risk factor of the NCD among the childhood and the adolescents are increasing. So next slide, please. Yeah. And we can see here from the last survey in 2023, the consumption of the high-risk food are increasing. So across all the age group. So like the sweet food or sweet drink, it's all increasing the trend from the previous survey in 2018. For example, in the beverages, it's increasing with the 4%, and then the soft drink almost same, but other instant food and the beverages are like increasing almost 2%. The highest number is the food which sweet increase almost at like 6.5%. Next slide, please. Okay, so we can see here the impact of the increasing of the NCD, not only diabetes. This obesity and the overweight is really related with the diabetes. And from the pattern that we see the cause of death from 2009 to 2023, we can see the diabetes, which is in number 9 in 2009, it now become number 4 in 2023. And stroke still be the first one. And then there is an increasing on the chronic kidney disease, which previously we don't have it in 2009 as the top 10 cause of death in Indonesia. And what is the impact on the financial? The financial is almost or NCD in 2025 are increasing more than 50%. And you can see here the cost for the chronic kidney disease are increasing almost 500,000%, 500%. So it's very a big number in increasing the financial burden compared to 2019. So it's not within 10 years, but it's almost like 6 years. There is a very big increasing financial impact on the NCD currently. Okay, next slide, please. Okay. I think it's not showing. Yeah. I think the slide is not showing, but I can see from the graph there is a different dietary pattern in cereal and fat and sugar that usually as the frequently consumed. Okay, so let's go to the next slide. David, I think I'm borrow some of your slide. If we talk about the risk among the children and the youth, this is what happened in Indonesia. So many sweet food and drink that attract the children and the youth to consume more. Next slide. Okay. And this is from the UNICEF study. I think I will skip this because I hope David will explain this. But I would like to mention it's very close relation between the advertising, which currently many available in the social media with the exposure for the children and the youth. Next slide. Especially now because the involvement of the influencer. And then we know most the young people is attractive by, we call it the trend of FOMO. So sometimes they don't think about the nutrition in the food, but they just think because this is a viral and then it's talked by the influencer, and then they don't want to be the one who left behind. So the effect of FOMO is very something that influence our children and youth in terms of their consumption. Next slide. Yeah. So this one too, I hope David, you will from UNICEF will explain more regarding this. So if you say that you can eat what we call it bakso, and then you have like free iced tea, very sweet free iced tea, it will of course facilitate more consumption on the high sugar, salt, and the fat and clothes. Sometimes the calorie is more than we need daily intake. Next. Okay, and sometimes we know if the price is cheap, they will buy it, although maybe it's not really a healthy food, because sometimes more in terms of number and it. Okay, next. Yeah, so that's something that one of the study from the UNICEF team. So the food advertising and the marketing is one that influence our children and our youth to consume more with the high risk food, including ultra processed food, but not only the ultra processed food, but food which are high sugar, salt, and fat. Next slide, please. So this is the study from the UNICEF too. I think later I hope David will inform more. Next slide. Yeah. So what the Ministry of Health strategy and the policy. Of course, the first one is we have health type with the balanced nutrition. So we have a balanced nutrition policy and strategy under the Ministry of Health decree in 2014. And then now it's already mentioned by the previous speaker regarding the isi piringku. But now isi piringku, I think it has been changed, not 30% with the, you can see from the left side, now it's become a tea style, not 30%, but now vegetables and 25% in the protein. So the isi piringku is not longer like 30%, or 1/3 of the dishes, but now it's become tea letter in terms of consistent of the nutrition. Next slide. And another thing I would like to, in terms of that's week, the first strategy, of course, the prevention, and then the second strategy of the overweight. We do through the current national program, what we call it the free medical checkup of CKG. This is one of our president's program in health. So this is we implement the free medical checkup, starting from we measure the height and the weight, so we can detect if there is like a trend for obesity or trend for overweight, which includes some the stunting or the undernutrition. As we know, this is still a problem in Indonesia. Next slide. Okay. So this is in the school. We do the early detection for with the the children, the elderly, or even the child under 5 years, if they have a problem with the obesity and overweight. So we can really try to prevent them in terms of having any possibility of the NCD. Type 1, we can measure through this activity. Next slide. Next, okay. So the other things that we do in terms of prevention and promoting the healthy lifestyle. We know that we need to control the sugar, salt, and fat consumption. So We can see here the what we are do for controlling the risk behavior or control. The first one is labeling policy. So we know sugar, salt, and fat content in their ready to eat foods. You might know, I think last week we are launched this education for Nutri-Level to be available as part of promotion on the healthy lifestyle and educate our community to read they consume some of beverages. The second one, in terms of the SSF policy, we have the advertising policy. I already show you how the advertisement, which include influence the children and the youth in terms of their
Nadia,
consumption pattern. So
your voice is breaking. Sorry. Yeah.
we know that their product are. Yeah. Is it okay now? Is it okay, Doc?
Yeah, it's better
Hello?
now. Yeah.
Oh, better now.
Yeah.
Oh, okay. Yeah, yeah. I'm turning off my camera. Okay. I will just move fast. Beverages that higher than the limit and promoting or sponsoring some activities and in the special location and the special target group. And then second one is the sales policy. And then of course we have the exercise tax that currently already in the Ministry of Finance. We do hope it can be soon implemented. And lastly is the reformulation policy. Next. Okay. So I think this one is not showing the. Okay. So I'm just showing the Nutri-Level that already been launched last week as part of education the community, and it gives some time for the industry to adjust with the current policy. And next one, of course, I think the other thing, Ministry of Health cannot be working alone. So we need other stakeholder to coordinate in terms of sugar, salt, and fat control, including to prevent our children and our youth for the high risk behavior on the SSF. Next slide. Okay, next slide. So maybe the next slide is more detail on the strategy for controlling high sugar, salt, and consumption, such as establishment the regulation. We are setting the maximum limit of the SSF, conducting education and mass media campaign on the food and beverage consumption, like we do now in last week through the launching of the Nutri-Level label, and then provide availability of low sugar, salt, and fat food in the school, in the workplace, or in the supermarket. Also, should be more various food and beverages with low sugar, salt, and fat. And we do the restriction on the advertising and promotion. The regulation still under development. And then, of course, like tax exercise, fiscal policies, and then reformulation. I think that's the current policy and strategy from the government to prevent children and youth of course, we should start the intervention in terms of the risk behavior, not taking the disease or the obesity or the overweight condition. So we really would like to have very well understanding in terms of the children and youth, how their consumption will be affect their study or their other achievement. So we, like I mentioned, the Ministry of Health cannot be working alone. We need more other ministry to join this effort in terms of controlling SSF, including such as Ministry of Education. We already have the modules for the SSF controlling, but still we need the support from the Ministry of Education to implement at the all school level. I think that's all, Prof. Rina, that I would like to mention in responding our other resource person. Thank you, Prof. Rina. Over to you, Prof. Rina.
Yeah. Thank you so much, Dr. Nadia, for highlighting the comprehensive multi-level strategy and also some regulation exists and also newly launched and perspective around also the government role as also distributed across the sectors, the Minister of Health, BPOM, and all the other ministries working together, and how the role also of private sectors, CSO, and so on. Okay, this is will enrich our discussion. We will proceed with the question and answer. But before that, there will be a few words from Dr. Neha. Dr. Neha, because there's something related to many of the ultra-processed food. I understand you would like to mention a few words before we proceed with the question. Dr. Neha, time is yours.
Yes, I just want to thank you very much. Again, the evidence on the multifaceted health impacts of ultra-processed foods, I think, is undeniable. All of the excellent presentations and presenters have just highlighted that this is no longer if action needs to be taken to protect children and youth, but what forms this response will take. And structural, systemic, and environmental efforts will be key, complemented by, of course, consumer-targeted efforts. I look forward to seeing this discussion progress, and I'm very honored and grateful to have been part of today's discussion. Thank you very, very much.
Thank you very much, Dr. Neha, for your contribution, and hope we can work together in the near future on this field. Yeah, thank you. Okay, so we will go into the next discussion. To begin with discussion, I would like to invite each panelist to share their perspective on the following guiding questions. So we would like to invite all the panelists to be in the spotlight of this event. Yeah, okay. Yes, the first will be on, this is all perspective, but I would begin to one by one perspective and then later asking also specific question on different institution. The general question is that if we combine the perspective that we heard a lot from the keynotes and also many different panelists information around scientific evidence, the global framework, and also some initiative in Indonesia, in the Indonesia policy context. This is a very technical question to ask about what should be Indonesia top 2 and 3 priorities moving forward in your perspective. So I would start with Ibu Dina Kania from WHO Indonesia, and I will follow also with one more question to her, and then continue with the next panelist. Ibu Dina, if you would like to comment on that. Ibu Dina is in Fiji right now with the heavy storming weather. Yeah, Okay, Budina, are you available to give comment?
Prof. Rina, can I switch my device first and can you hand it over to the next speaker? Yes.
Okay. Yeah. So I would like
Because I
to
cannot hear
ask.
your voice very well. Sorry.
Okay. Do you want to repeat the question, or you will wait for the other device change?
Yes, I will change my device, Prof. Rina.
Yeah. Okay. Yeah. Okay. I will continue first with Dr. David. Yeah. So, what is your perspective? So, when, of course, there's always a difficult question, right? If you talk about top 2, 3 priorities, but of course, UNICEF also has some evidence related to that, and would like to give comments on that.
Yes, thank you so much, Prof. Rina. It's not an easy question, and it's a bit harder to go first, I guess, but I'll just give my 2 cents. So I think we can all say that, especially with Regulation 28/2024, we already have a strong legal framework for action on all the policy priorities that we all, let's say collectively, I think we can agree we need in Indonesia. Maybe if I had to highlight just a couple of things. First of all, perhaps the absence of a nutrient profile model for Indonesia is a bit of a limitation for some of these policies. In the sense that, of course, we have regional guidance for Southeast Asia from WHO, and that's a scientifically valid anchor for these policies. But often having more contextual documentation, let's say, in the form of a country-specific nutrient profile model is helpful. For example, to anchor policies like front-of-pack labeling, and also to use these policies in turn to frame, for example, unhealthy marketing restrictions in food retailers, as well as in the digital food environment and in schools. So, for example, through our work in schools, even those schools that had individual initiatives to limit the sale of ultra-processed food within school grounds often had that issue of how do we define healthy foods, right? Or unhealthy foods, rather. So having these tools, the nutrient profile model, I think would solve some of those issues. Then maybe I will mention a few cross-sectoral issues that I think are common to most of these policies. First of all, the voluntary versus mandatory implementation that was highlighted also by other colleagues in the panel. I think in the case, for example, front-of-pack labeling, but also marketing restrictions, we do have evidence from other contexts that suggests very strongly that when these regulations are voluntary, they're not as effective as they should be. So really using this evidence to guide the implementation of the policies that we already have or that will be developed is really critical. The second point maybe is safeguarding all these policies from conflict of interest. We've heard from previous panelists, for example, the SSB tax. I think Dina mentioned the long history, let's say, that we have here in Indonesia in trying to implement this tax. Of course, political will has been sort of dwindling, but also because of industry pressure in that sense. So having strong safeguards, transparency, public consultation mechanisms, that would be really helpful, not only for that specific policy, but also for, say, front-of-pack labeling and marketing restrictions. And maybe if I were to mention one last point, just making sure that through cross-sectoral collaboration within the government, so the different line ministries, BPOM, and so on, we ensure that these policies are linked. So, for example, now that we have the Nutri-Grade decree, how does that help develop, for example, new and stronger marketing regulations? Once we'll have those, how will those help regulate, for example, specifically the issue of school food environment and so on. So just that we look at these as a policy package rather than individual interventions. And those data points that I presented from our study on the cost of inaction and return on investment on these policies, I think really make a good case, not only from the health perspective, which I think is what most of us here today are interested in, but also from the broader sort of socioeconomic and developmental perspective, because it would really bring lots and lots of savings, not only in health terms, but also in monetary terms. Thank you. Over back to you, Prof. Rina.
Yeah, thank you, Dr. David. Just for other questions related to the presentation of Professor Huan on the 2025 report introduced the idea of safe and just space for food system that's also reach children related right to food. So what would be the UNICEF food system framework to also align with the just food system?
Thank you, Prof. Rina. Another challenging question to address in just a few words. Maybe what I can highlight is that what I presented today is just sort of like a snapshot of what UNICEF is doing in terms of evidence generation for policy advocacy specific to ultra-processed foods and school food environments. We also do a lot of work that also targets other very important groups, population groups here in Indonesia. So, for example, all the work that we do around breastfeeding, around commercially produced complementary foods for young children. I see all of these linking through the food systems transformation agenda. So your question is, how do we make sure that these transformation is just for everyone? I think in a very simple sentence, by ensure that it goes through systemic change rather than through sort of placing the burden on the individual. So policy change, systems change, as opposed to say education, awareness raising, and blaming the individual. Of course, education, for example, is still an important component of these, as is social behavior change, as we've heard from the colleague presenting all the insights from social sciences. But I think what we need to ensure this transformation is socially just, especially in a country as diverse as Indonesia, because of course I am sitting here in Jakarta, but Jakarta is definitely not, Yogyakarta or Makassar or I don't know, Jayapura. So we really need something that is able to transform food systems at the core in order to deliver transformation at scale at individual level across the whole country in its diversity and the whole sort of socioeconomic spectrum of all Indonesians. Thank you.
Thank you so much, David. We learned a lot from your perspective. So I will move on to Mrs. Lois from Bappenas. I understand maybe we still need time for, so I will move on to Ibu Lois. Yeah, okay.
Yeah, Prof.
Okay. Lois, I understand that you have presented a lot of perspective from Bappenas. And we would like to, there's a question related to how Bappenas' perspective when aligning scientific evidence, global framework, and national priorities. We learned from Pak Bumkas, there's all Western or high-income countries related evidence are quite useful, but not all are quite adaptable to Indonesia. So maybe you have perspective on this one, and what are the top 2 or 3 system-level action in Indonesia that Bappenas has presented earlier as the numbers of ambitious plan that you would like or Bappenas prioritize to drive meaningful improvement in diet quality and nutrition, especially in children and adolescents?
Yeah, thank you, Prof. Rina, for the question. That's very fundamental in shaping the policy direction to ensure the nutritious food for everyone in Indonesia. Basically, if we refer to our planning cycle process, that and the first step is technocratic process that Bappenas will gather all of the evidence related to the fundamental and strategic issue related in Indonesia, and that all of the study will be identified into the specific or strategic issue that will affecting not only one single area, but also to the multiple sectors, like nutrition is like a nutrition issue is not really direct to the health status, but also it will affecting the economic as well as the education sectors, and also the environment areas. So that part is it's a critical process that Bapenas will gather of all of the evidence from the national as well as the global benchmark practice in general, and actually also in terms of the planning a cycle, we also conducting like operational study or research to understand to what extent the policy could be implemented well in the local and grassroots level. So that's also our critical area to ensure that the policy design could be implemented in the local specific area, and then that activity is being part of our monitoring and controlling process every year. That's part of that's very critical to ensure and mitigate the risk of the program, Prof. And however, we also understand that at some point the political influence is very critical in developing the planning as well as the policy. That's our challenge to balancing evidence and also politic interest to ensure that our policy still align with our long-term agenda. That's our challenge in Bapenas to balancing that process, and that's because that's very critical. We also realize that Bapenas cannot working alone. We need working together with multiple stakeholder within the government's ministries as well as the academia and our developing partner to echoing our such issues and also our priority agenda, so that that could be resonating big and also being internalized to all the community as well as our political leaders. So that's our complex process in and translating the evidence into the planning as well as the budgeting document, Prof.
Thank you very much, Mrs. It's really interesting that when you mentioned very important highlight when you mentioned about balancing evidence and political interests. I think this will require strong governance. I believe that Bapenas are going forward to that, and of course, this is. I hope that this event will also give some contribution to the evidence for Widya Karya Pangan and Gizi, boys. So then it will be evidence-based informed and would also be a benefit for a short-term plan as well as the long-term plan. Thank you, boys. So I will move on to Ibu Dina. Ibu Dina, are you available now?
Yes, Professor Rina.
Yeah. Again, of course, there's a lot of regulatory action has been presented also, Ibu Dina. So again, the same question: what Indonesia should prioritize immediately to reduce the children exposure to unhealthy food environment? In your perspective, maybe 2 or 3 priorities action.
Yes, so thank you very much, Professor Rina, and apologies for the inconvenience in terms of the connection. I'd like to echo what David said regarding the importance of developing a nutrient profile model. So this is a very important tool because this will identify foods and beverages that this will help to classify foods which are healthy, less healthy, or not healthy. And Actually, for the time being, WHO is providing technical support in developing this nutrient profile model with the Indonesia FDA, since they requested the support from WHO. And this nutrient profile model will actually be a basis or a reference for the development of other policies. For example, the marketing restrictions. Because if you look at the global practices from other countries, before they decide which foods that are subject to marketing restrictions, this needs to be defined by the nutrient profile model, right? Because the nutrient profile model then will determine the scope of the foods that will be subject to marketing restrictions. So priority number one will definitely be a nutrient profile model. And that is actually in the process of development. And once WHO finished with this, we will definitely share with the government. And in fact, the development of this NPM will also involve and engage the government, the Ministry of Health, BPOM, the Menko PMK from the very beginning. And in terms of the policy, Professor Rina, I think I've mentioned earlier in my summary at the beginning of this panel discussion that we should focus on implementing the FOPL, which MOH recently issued, the Nutri-Level. And we are also waiting for BPOM, Indonesia FDA, issue a similar regulation that will apply for processed packaged drink. Yeah, because the one that MOH issued applies only for ready-to-drink beverages. So we are waiting for similar regulation to be issued by BPOM that will apply for processed beverage. Number two, as I mentioned again, it's excise taxes on SSB, and this, if it gets implemented, this will complement with the FOPL policy that both MOH and BPOM has issued or will issue, because the FOPL will apply to beverages and the excise tax on SSBs will also apply to beverages. So when these two measures are implemented at the same time, this will definitely educate the consumers, to really identify which drinks or beverages that are healthy and which drinks that are unhealthy and therefore should be avoided. And of course, number three, once we have the NPM, then I think the next step would be to establish or develop a policy on the marketing restrictions. We have the legal norm in the PP 28 in the government's regulation number 28/2024, Article 194 and Article 195. However, this needs to be further regulated under an implementing regulation, be it a BPOM regulation or be it an MOH regulation, or it may require a new legislation, such as I think we have at the moment food labeling and advertising government regulation that is still in the process of revision. So those are my three priority policies, Professor Rina. Let me repeat: implementation of FOPL, excise tax on SSB, sugar sweetened beverage, and marketing restrictions. And prior to that, we need to develop nutrient profile model. Thanks, Professor.
Yeah. Thank you very much to highlight from WHO as well as UNICEF the importance of nutrient profiling model as a foundation, defining foods healthy or not, and it will actually translate into many different policy. And you also highlighted the SSB tax, marketing regulation. That is all. We hope that it will become effective together. Yeah, so to really work to protect our children and adolescent food. Yeah. Thank you, Ibu Dina. Then I will go to the next one to Ibu Supra. I understand that, and also Pak Ibnu, but maybe let's go to Bu Supra because a lot of talking already about how this linked to social determinants and in the perspective as a social science, if you look at this all ongoing discussion, how you think that the priority in related as an academician to suggest the government and then also looking at the perspective, not only nutrition, food, health, but also social determinants of health. Yeah. We surprised you're still there. Yeah, okay.
Audio. Thank you so much, Prof. Rina. Yes, I have certain points to give this afternoon. The first one is that, yes, we do not only talk about metabolism problem related to UPF, but also the psychological, behavioral, and probably also the cultural matters. Some subculture in Indonesia maybe prevent even not only contribute to the development of giving UPF, but probably they have a burden in their subculture. I still don't understand about this, but I just think that probably culturally we need to do something. And then, so my point of view is more to well-being and behavioral segment of the children and adolescents. That's the first one. And the second one, I believe that we need to put child and adolescent first because they are the groups, the age groups that will be the pillar of national development in any kind, in any sectors of national development. I understand, or we all understand that when we talk about UPF, we also talk about not only health, but also social factor, cultural, and economy, especially the business area. So we should aware of that, and it will lead to a difficult negotiation, especially about the economic sides. So, but we need to do that because as we learn from all the presenters, that economic or business in this area is very thick. So we need to elaborate in that. And thirdly, I would like to propose that all that already exists, whether it's regulation or policy, it's not only please not only centralize in the Ministry of Health, but we also need the Ministry of Education, especially the basic education and secondary education, because those are the children and adolescents are going in their life. Thirdly, also about the communication, the Ministry of Education and Digital Affairs. We learned that a lot of propaganda of UPF is going from social media. So we want to let this ministry, communication and digital affairs, aware also, not only about now they ban the use of social media at school. But they need also aware that UPF is very thick in the social media. Thank you.
Thank you so much, Ibu Supra. Because of interest of time, I would briefly ask Pak Ibnu and Dr. Nadia, maybe start from Pak Ibnu for a briefly comment also as a CSO working in grassroots and also working, I think you also have some initiative around the promoting the real food as well as the sustainable food system. Yeah, would like to comment also. Pak Ibnu, time is yours.
Yeah, thank you, Prof. Rina. Yeah, maybe I would like to add to what have been mentioned that we agree with what Budina and also David mentioned before about the three priority that should be pushed forward. The first one is the FOPL, the front of pack nutrition labeling. We hope that the FDA can issue the regulation soon, so we don't have to wait as long like before. In the previous case, it took quite long. And so hopefully this year that regulation can be issued, so it can be implemented by the food industries. And hopefully this also transition to mandatory basis also can be faster and include not only the ready-to-eat drink, but also the other ultra-processed foods. And then the second one on the SSB tax, this also another thing that should be pushed again. I think that this discussion also has been happening for some time, but it's quite difficult struggling around the stakeholders about this issue, I guess. This issue is also important because the SSB, the sugar sweetened beverage, is not only an issue for the health, but also for the environment in terms of waste, especially plastic waste that is produced from these foods. This is related to the bigger framework on the food system transformation that has been mentioned in the Eat Lancet report that presented before. And then the last one on the marketing restriction, and this is also important, and this is related to what you mentioned, Prof. Rina, about the initiatives on promoting the healthy foods or the local foods. It's very difficult for the healthy foods and the local foods fighting against the massive large-scale marketing of the ultra-processed food. So without marketing restriction on ultra-processed food, it's difficult to for the healthy foods to be promoted against those large-scale marketing, especially in this era of social media and a lot of information that have been spread across different media, and with their large power of marketing and the small power from the healthy food producers. So yeah, it's difficult to fight against those big marketing for the healthy foods promotion. So yeah, maybe those are the three priority from our side. Thank you, Prof.
Yeah, thank you very much, Bapak Ibnu. And last but not least, I would like to invite Dr. Nadia. As the Ministry of Health is the leading sectors and also could be is the lead of the protection for the child and adolescent food and health. So there's a lot of proposed priority in relation to nutrient profiling, SSB tax, marketing restriction, and how the FOPL can be implemented well. So as well as the promotion of healthy food. So what would be your last comment? Of course, that we'll put in place the Ministry of Health as leading sectors of this field. Yeah. Nadia, time is yours.
Okay, Prof. So we heard a lot of evidence and information, and of course, in terms of the policy, I think our health law, and the presidential decree already have a strong message in terms of regulate the salt, sweet, and fat. Of course, all we think is about to prevent our children and the youth, especially because they don't really understand the situation. Like I mentioned, now it's a very the characteristic our children and youth in terms of choosing their food or their consumption based on the viral situation or the FOMO situation. So we realize and we know from the study that David and UNICEF already mentioned, from the UNICEF support and from WHO support, we really understand. But of course, some with WHO policy or advocacy cannot be implemented directly, but we start step by step by having a certain time for industry and of course for the community to accept, because if we have some product which not really fit with the community, they will not take up this policy too. So that's why we start for the nutrition level by having the education. Within 2 years, they will be like a mandatory in putting the label. And then the other things, like I mentioned, we're working with the Ministry of Education, providing the information and part of their curriculum. And of course, for through the Ministry of Home Affairs, for the provincial, the government, head of the district, at the major, they have like we call it the policy and regulation in terms of limit the high sweet and salt and fat consumption. And other things, like I mentioned, that this is not only the Ministry of Health alone, so we need to be with other ministry, for example, including the Ministry of Trade, Ministry of Industry. They are the one who really involved deeply with the all the food and beverage industry. And then we can close together with BPOM in terms of the this kind of policy too. So I think thank you very much, of course, Prof. Rina. Through this forum, we heard a lot of things, the information that can be part of our next step in terms of the developing the policy and the regulation. Just to inform everybody that we have currently developed our roadmap for regulate controlling the sweet, salt, and fat consumption. We do hope it's still very new, very early stage in the developing of our roadmap in SSF policy. Of course, we will invite everybody and welcoming any inputs to enrich the step for controlling this SSF. That's
Thank you
all
very
I
much.
think.
Yeah, thank you, Dr. Nadia. Yeah, ladies and gentlemen, due to time constraint, we already offered the time. So thank you for being here and very patient for everyone, also for panelists. So thank you for the panelists, sincere appreciation to your contribution, sharing your valuable insight, and also for all participants who engage to this panel discussion. So I hope that this will be very useful for not only for policy, but also to further engagement between academia and also all the policymakers, the grassroots implementer, and of course the civil society. Yeah, I will give this floor to Master Ceremony. Again, thank you very much for Ibu Nadia, Ibu Is, Pak Ibnu, Bu David, Pak David, sorry, Bu Supra, and Bu Dina. Yeah, okay, bye-bye. Okay, over to you for Master Ceremony.
Thank you very much, Prof. Rina, and also Prof. Yodi for leading such an insightful and engaging policy panel discussion session. We also once again extend our sincere appreciation to all speakers, panelists, and participants for the enriching discussion. Ladies and gentlemen, we shall now proceed to the next session entitled Academic Insights from the Council of Medical Professors. Allow me to introduce our distinguished speaker, Professor Thaddeus O.H. Prasetyono, MD, PhD, representative of the Council of Medical Professors, Indonesia. Professor Thaddeus Prasetyono is a distinguished professor in plastic surgery and hand microsurgery consultant at Universitas Indonesia and Cipto Mangunkusumo Hospital. He currently serves as a chair of the Faculty of Medicine Professor Council at Universitas Indonesia. Ladies and gentlemen, please welcome Professor Thaddeus Prasetyono. Professor Thaddeus, the screen is yours.
Thank you very much, Ms. Walla, Ms. Ilana Walla, for the opportunity. And I have no disclosure with these presentations. Although I'm not expecting that I'm going to be giving sort of wrap up because of the expert has been explaining things very clear and also with a proper understanding, but I do just, fulfilling the task given by the society. So I'm representing the Indonesian Council of Medical Professors. So I'm starting with this picture. I believe you all have already listened to the sharing from the experts. On the left-hand side, we see on how healthy life should be related to the components or ingredients of meals. However, on the right-hand side, it's just the fact here in every part of big cities and including the villages across the country, that might be chaotic situations with the fact with the availability of these products. So I would say that nutritious nibbles for sprightly kiddos and tubercharged teens is something that we can consider as whether as a way to pass the time while traveling or even as a coping reward, sort of quote unquote. Snacks can be an important part of cultural experiences by providing healthy, natural foods. It develops automatic eating behaviors. So the experience of being exposed to and enjoying healthy, natural foods can shape a culture of healthy food choices in children's future. That's one of the idea in the future that we could take this point as an important point in our daily life. On the other hand, we have observed on how our traditional snacks and various traditional foods also require attentions to modifying their components, considering that most of them are made of flour, staples, and sugar. You can debate this statement, but there's fact that all jajanan pasar, it's all about the content from staples and also sugar. So again, as the task given by the committee, we are talking about real food for child and youth health. And of course, we can still include minimally processed diets. And it's about aligning science and the policy that we have listened to all the panelists and speakers. The discussions also give us a very good perspective and even coming into excellency if all stakeholders are heading to the same goals and also going through the collaborative tracks and pathways. So we are moving from a nutrient-centric view to a food matrix view. And the goal is not just to fill stomachs, but to protect metabolic health. Toddler overweight can be still considered low, but 4.2% is still, numbers that have to be problematic for our populations. And school-age obesity can hit as high as 15% in urban hubs. So this is all about the rise. And 70% of kids ages 5 to 9 consume UTFs more than 3 times per week because it's very easy to get, it's affordable, and it becomes the habit of those children. Indonesia is the regional leader in sugary drink consumptions. Unfortunately, it's all because of the SSB factor, the sugar sweetened beverage that we have listened to the experts since the morning. And our country, I'm talking about Indonesia, still face triple burden. Not only that the fact we are still fighting stunting, but also children obesity or child obesity is on the rise, accompanied with metabolic syndrome such as insulin resistance, type 2 diabetes, hypertension. They are all the diseases that appear in children's life. So processing matters. We understand from the perspective about how the definition has been, the expert has been making proper definition and also classifications through NOFA for definitions. It's not about food only, but also about industrial formulations. And those UPFs give like the chance for children to have dopamine loop because the meals, the food has been designed as hyperpalatable meals or food, bypassing satiety, leptin signaling. And it causes also inflammations with the fact that low fiber and emulsifiers would be similar to gut dysbiosis and also early onset of NCDs. The UPFs are biochemically different, so they lack the cellular structure of real food, leading to rapid glucose spikes and also chronic inflammation. Regarding the food processing spectrum, this is just an example taken from corn. Level 1 is considered to be minimally processed food. As a whole food, this is about natural state of this, example of corn, which is rich in fiber, vitamin B and C, and also has the component to be enriched naturally with antioxidants. And that this is about complete food matrix, and it should go through minimal changes. So level 2, it's about processed food. Processed mean modified for preservations, added salt and or sugar for flavor and shelf life. This is about basic structure that is still intact with some nutrient loss. That's the fact. And this because of the industrial transformations. But level 3 that comes as monstrous, smiling monstrous picture like on the lowest row, it's all about highly processed formulations because the meals, the food, high added sugar, salt, and fat. It has low fiber designed for hyperpalatability and it's addictive dopamine loop. It causes high risk in obesity and also metabolic syndrome. So UPFs are biochemically different. They lack the cellular structures of real food, leading to rapid glucose spikes and also chronic inflammation, as I have just mentioned before. As doctors and many of the speakers and also the faculties, including the panelists, are doctors. I believe numbers of doctors are in the audience, and doctors have oath to do no harm. By allowing the unregulated flood of UPF into our children's diet, we are actually permitting systemic harm. So policy as clinical prescriptions can be seen through the discussions since the morning, especially the part in the panelist sections. The government regulations can be seen as medical intervention tool, and the Nutri level is mandated to be labeled A to D to shift the social norms. And we are happy to know that our government has considered taking actions to this. Protecting schools is also something that we need to take actions by eliminating Nutri-level D products from school environments. The fact is that, it's based on the idea, which is very simple in our daily life, as we cannot expect a small child to make a personal choice against $1 billion marketing engine. So policy is the shield. Again, based on policy interventions, our clinical prescriptions would see it as, stoplight by giving label red with a high risk or stop or limit the consumptions and also the marketing. And green label would be going for healthy meals or real food. So this is about front of back labeling. It's a mandatory Nutri-level signal that we need to put into all the products to enable healthier choices for children and for teenage, and of course, even for family, of the parents. We need a megaphone in regards to marketing restrictions, marketing ban, eliminate predatory advertising to children, especially digital and school zone. This is to protect our children's environment and also to reduce the UPF appeals. At the other point, as the panelists has discussed, a fiscal policy needs to be considered. A fiscal neutrality can have revenue from taxes on the unhealthy products to directly subsidize the real food. Health should be more affordable than illness at the end of the day. And we do really expect that the real situations in the future would not be repeating the fact that government has put tax on cigarettes. However, the intention so far we have observed that it's merely for revenue. The life changes among smokers are not really that significant because smoking habits are still around in every part of the archipelago. So there should not be a repetitions in regards to policy and also the implementations. We are expecting that. So academic roadmap would be including reinforcement actions by technical regulations for sugar, salt, and fat limitations, and then taxing the SSBs, subsidize local minimally processed real food as an incentive like I have described through the fiscal neutrality. And the important aspect is long-term study on UPF consumption patterns and outcomes should be taken into account. So all the experts are being on call now to go for long-term study. Eat real food. It is not a lifestyle choice. It is a medical necessity. So the future of healthy Indonesia by 2044, this academic roadmap is asking for actions. The academic roadmap is for a resilient generations. With that, I would like to thank you, the organizing committee, to give us a chance to share our point of view, not as a wrap of the presentations, as the webinar or for all the day, but as a reminder for all of us to take actions. Once again, thank you very much.
Thank you very much, Professor Tadeus, for your valuable and insightful presentation. Ladies and gentlemen, we have now arrived at the final session of today's program, entitled Summary of Key Messages and Closing Remarks. It is our great honor to invite Professor Herawati Sudoyo, MD, PhD, Chair of the Medical Science Commission and Head of the Organizing Committee, to deliver summary and closing remarks. Prof. Herawati is a leading Indonesian scientist in human genetics and genomics. She is currently as a senior scientist and principal investigator at the Mohtar Riyadi Institute for Nanotechnology. Her work focuses on human genome diversity and precision medicine, and she leads the Indonesian Genome Diversity Project. Ladies and gentlemen, please welcome Professor Herawati Sudoyo. Prof. Herawati, the screen is yours.
Thank you very much. Good day, everybody. Speakers, partners, and participants for your valuable contribution. As we come to the end of the important webinar, allow me to reflect on a few key messages in less than 10 minutes for 5 hours presentation and discussion of 13 speakers, including welcome and opening remarks. First, the science is clear and increasingly consistent. High consumption of ultra-processed foods is not just a dietary concern. It is a serious public health issue, strongly associated with childhood obesity, micronutrient deficiency, metabolic disorders, and the early onset of non-communicable diseases. At the same time, today's discussion highlights an important shift. Diet quality is no longer defined only by nutrients, but also by the degree of processing. This represents a significant change in how we understand what constitutes a healthy diet. In response, global guidance is converging toward a simple but powerful message. Eat real food and prioritize minimally processed diets. This is reflected across multiple frameworks. We heard from W guidance, UNICEF, from other country guidelines to the Eat Lancet framework, and importantly, also in Indonesia's own isi piringku. But ladies and gentlemen, knowledge alone, we know is not enough. We heard a central theme of today's discussion is that children and adolescents do not make choices in isolation. They are navigating food environments that are often stacked against them, where ultra-processed foods are more available, we are all agree, more affordable, and more aggressively marketed than healthier options. This leads us to critical conclusion. We cannot rely on individual behavior change alone. We must shape the system that shapes those behaviors. And then, where policy becomes essential. Today, we have discussed several high-impact policy levers. Front of pack labeling, an important entry point that not only informs consumers, but also helps shift norms and encourages product reformulation. Restriction on marketing to children, not only regulation, but a necessary measure to protect children's health and rights. Fiscal policies that can help rebalance affordability and make healthier choices more accessible. And importantly, the value of integrated approaches. As seen in countries, many countries, maybe Chile is a model in Latin America because it's the first country to adopt a warning label approach to delineate UPF. Combining labeling, marketing restriction, and school food policies can lead to measurable and meaningful impact. For Indonesia, these discussions are particularly timely. The implementation of government regulation, we heard mentioned many times, PP number 28, year 2024. presents a significant opportunity to move from commitment to action. Through stronger food labeling, better regulation of sugar, salt and fat, and alignment of dietary guidance with practical system-level interaction. However, as highlighted today, important gaps still remain in implementation, in coordination, and in protecting children from increasingly complex food environments, including, mentioned many times, digital platforms. This is why collaboration is critical. One of the most valuable outcomes of today's webinar is the strengthening connection between scientists, policymakers, academic institutions, and international partners. Together we can. Addressing this challenge requires sustained multi-sectoral engagement. I think from the IP point of view, looking ahead, we have two important deliverables. The first one, I think we should make a policy brief which will synthesize the scientific evidence, global lessons, and Indonesia-specific gaps into clear and actionable recommendation. IP also can contribute maybe to several action plans with a phased approach. Mention also short-term, medium, and long-term. What about short-term? Strengthening coordination across sectors. Medium-term, advancing policy implementation and technical development. And long-term, building monitoring system and research to track progress in children's diets and food environment. And in closing, let me emphasize this. Improving child and youth nutrition is not only about preventing disease. It is about shaping of the future of a generation. If we succeed in creating healthier food environments where real food is accessible, affordable, and desirable, we enable children not only to choose better, but to truly thrive. This is both scientific responsibility and policy imperative. Kita tidak bisa, let me say in Indonesia, kita tidak bisa menunda lagi. Kita harus menciptakan lingkungan pangan yang sehat, yang merupakan langkah nyata untuk melindungi masa depan anak-anak Indonesia. Thank you again to all distinguished speakers, partners, and participants for your valuable contribution. We look forward to continuing the important work together. Thank you very much.
Thank you very much, Professor Herawati, for the comprehensive summary and closing remarks. Ladies and gentlemen, before we officially conclude today's session, let us follow a video message from the Chief Science Officer of the EAT Foundation, Mr. Fabrice de Klerk.
I'm thrilled to welcome you to this, I think, truly exceptional seminar on Eat Real Food and Processed Diets for Child and Youth Health. My name is Fabrice de Klerk. I'm the Chief Science Officer at EAT. It's a real pleasure to be able to share this moment with you. I apologize that I can't be with you there in person, but you're in very, very good hands with my colleague, Dr. Rina Agustina, who served as a commissioner on both the 2019 as well as the 2025 Atlantic Commissions. I think the topic you're about to discuss today is fundamentally important. And while you may be focused on it from a primarily health perspective, I hope that I can convince you in these few brief words that you really are tackling a challenge which not only impacts human dietary health, but also environmental health and justice. I'd like to remind you also that Indonesia holds a very special place in our heart for those of us that eat. In January of 2019, we hosted the Eat Food Forum in Jakarta. This is the only other capital outside of Stockholm that has held such a forum, and we hope to be able to return and do this with you again sometime in the future. I want to talk about food, however. When we look at food, which is our number one or our primary relationship with health, the numbers are concerning. In Indonesia, you have made tremendous progress in terms of tackling malnutrition. 1,116 daily reduction in malnutrition in Indonesia, bringing malnutrition down from the third most important source of premature mortality to the fifth over the past 10 years. This is tremendous and it should be celebrated. However, I think we need to pay very close attention to what's coming behind that. Diabetes and both obesity are up. Diabetes up from number 8 to number 6, and obesity up from number 10 to number 8 as primary cause of premature mortality in your country. 376 DALYs for both of those numbers. We need to celebrate the progress of malnutrition while at the same time being very cautious about the new challenges coming and avoid repeating some of the patterns that we see in other countries. Second, what we found with the Atlantic Commission is that what foods we eat, how we produce them, how much we lose in waste, have significant impact on environmental health. Food is the number one driver of planetary boundary transgression. 80% of biodiversity loss, 70% of freshwater use, 70 to 80% of nitrogen and phosphorus pollution, while at the same time being about 30% of emissions from greenhouse gas emissions. I know that Indonesia, you are acutely aware of this. You have significant international tensions placed on you vis-a-vis the global value of your forest and peatlands, vis-a-vis fighting climate change, as well as, of course, recognizing their national value for the biodiversity heritage and the pressure to convert these into productive agricultural or other systems. Significant opportunities in thinking about what foods we produce to help us achieve that challenge. Finally, justice. Work that we produce with the Atlantic Commission emphasizes this is the third primary pillar that we should all be focusing on when we talk about healthy, sustainable, and just food systems. Here, we encourage you to look at those actions that allow you to ensure healthy diets available and accessible to all, while supporting consumption patterns that bring us back within environmental limits, recognizing that an unstable climate system and unstable environmental systems are other forms of injustice to which too many people are suffering. With that, I want to encourage you to both participate actively in today's conversation and to take these learnings with you in your work in Indonesia. Please do feedback to us at EAT what those learnings are, because the work that you're doing at a national scale really is significant. It's important and influential in understanding those kinds of actions, which are context-specific, adaptable, and impactful. With that, I wish you a very good discussion, and I hope to hear from you soon.
We thank Mr. Fabrice and the EAT Foundation for the valuable message shared with us. Ladies and gentlemen, with this, we have come to the end of today's webinar. We sincerely thank all distinguished speakers, moderators, and participants for your valuable contribution and active participation. We also would like to express our deepest appreciation to the organizing institutions for making this event possible. The Indonesian Academy of Sciences, EAT Foundation, Master of Nutrition Study Program, Faculty of Medicine, Universitas Indonesia, the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Global Alliance for Improved Nutrition, and Food and Land Use Coalition. Your collaboration and commitment have been instrumental in the success of this event. We hope this session has been insightful and beneficial for all of us. Thank you for your kind attention. Stay healthy and have a pleasant day.